expected fire alarm testing today, and therefore, if the fire alarm does sound, please follow the fire and emergency procedures that are applicable to the Council House. Please, can I also ask that you use your microphone when addressing the meeting and that it is switched off when you are not. Your mobile devices are turned to silent, and this meeting will be broadcast live to the internet and will be capable of subsequent repeated viewing by entering the chamber. During this meeting, councillors and members of the public are consenting to being filmed and for the usage of those recordings for webcasting purposes. Thank you. Moving to item 1, apologies. Elliot, do we have any apologies for today?
Thank you, Chair. No apologies for today's meeting.
Moving to item 2, I ask the panel to note Councillor Wood as Vice Chair for the 2024-25 municipal year, as noted at City Council in September. Noted? Okay, I wasn't going to introduce people, but as it's just us in the chamber, I'd like to just go around and introduce a few people, if that's okay, so everyone knows who is here today. I would also like to introduce my mentor, Councillor Victoria Cusworth. I'd start with you, if that's okay.
Yeah, hi, good afternoon, everyone. Sorry, I might be looking a little bit bedraggled. It was a very early start from Rotherham this morning. I'm really pleased to be here. Thank you for inviting me. And I'm the Cabinet Member for Children in Rotherham. Thanks.
Councillor Simpson, would you like to introduce yourself?
Hello, my name's Alison Simpson. I'm a councillor for Bud's Head Ward. I was elected this year, so I'm quite new to the game.
Hello, I'm Paul McNamara, representing Efford and Lipson Ward.
I'm Councillor Dylan Tippett, representing Compton Ward.
I'm Councillor Lindsay Gilmore from Moorview Ward.
Councillor John Stevens from Plymouth Dunstan and Chair of the Scrutiny Management Board.
Councillor Daniel Steele, I'm the Councillor for Plymouth Radford Ward.
Councillor Krujanets, Councillor for Plymouth Dunstan Ward.
Councillor Terry Beer, Ward Councillor for Plymouth Now and Independent.
I'm Councillor Lauren McClay for Plimpton Chadderwood. I'm losing my voice slightly, so bear with me when I'm asking questions.
Lisa Lynn Scott, Service Director for Education, Participation and Skills.
Councillor Sally Creswell, I'm the Cabinet Member for Education, Skills and Apprenticeships.
Tamilela Salomon, Service Director for Children, Young People and Families.
Jim Barnicott, Head of Education, Plymouth City Council.
Isabel Morgan, Service Manager for Inclusion and Welfare.
Hi, Peter Lewis Cole. I'm Head Teacher at Lipson Vale Primary School.
I'm Paul Stevens, Performance Advisor who supports children's young people in services.
Hi, Sue London. I'm a Performance Advisor supporting Education, Participation and Skills.
Elliot Wangle, Democratic Advisor.
Hello, David Haley, Strategic Director for Children's Services.
Chris Wood, Ward Councillor for Egg Buckland and Vice Chair.
I'm Councillor Riley. I'm the Councillor for Honock now and the Chair of Children Scrutiny. There are some people on the screen that I can't see, I'm afraid, so I would ask you to introduce yourself. Is it Anita?
Hello, Anita Freer, Head Teacher at Stoke Drummoor Community College and Scott Medical and Healthcare College.
Thank you very much, Sean.
Yeah, good afternoon. Sean Nichols, Head Teacher at Wiley Court Primary School.
Rob.
Good afternoon, Rob Williams, Director of Education for the TEDRAG Trust.
And Scott.
Good afternoon, Scott Simpson-Horn, Head Teacher at All Saints Academy.
Fantastic, thank you and welcome everybody. I'm also quite blind. Moving on to item 3, declarations of interest. Do members have any declarations of interest in respect to the items on the agenda? Councillor Gilmore.
Thank you, Chair. It's just to let people know that I am employed by the NASUWT, the Teachers' Union.
Yeah, thank you. That's a personal interest. We're unlikely to make any decisions in relation to that today.
Thank you very much. Moving on to item 4, minutes from the last meeting that took place on the 18th of July 2024. Does the committee agree to the minutes from the last meeting? Can I suggest a proposer? And a seconder? Thank you very much. You got that, Elliot? Chair's urgent business. There are no items of urgent business. And moving on to item 6, inclusive practice to address exclusions and suspensions in Plymouth. Please can I welcome some of Plymouth's head teachers who we've just been introduced to the meeting, who are joining online. Please can I ask you to introduce yourself to the panel, but you don't need to do that, and I should have read that before I spoke. Thank you very much. Attendees will include Rob, Scott, Anita and Peter. Thank you for your attendance today, and please can I hand over to Councillor Creswell to speak to the report.
Thank you very much, Councillor Riley, and can I also extend my thanks for head teachers actually coming for this committee, especially as I know how stressful it can be coming out of school during school time, and so thank you very much. It's very much appreciated that you've taken time to come and speak with us and talk with us this afternoon. Right, first of all, an introduction. There has been a significant rise in the rate of permanent exclusion and suspension across the schools in Plymouth. The increasing trend is reflected nationally. However, permanent exclusions in Plymouth are rising faster than national and regional benchmarking. The causal factors which lead to children being excluded from school are wide-ranging and they are complex. Reducing the rate of exclusion in Plymouth requires a collaborative partnership approach. Plymouth City Schools and multi-agency partners are working together to develop the conditions for success and inclusion in our schools. What do we know about children who are permanently excluded or suspended? We understand the challenges that children who are suspended or permanently excluded face, both at home and at school. Last year, for instance, more than 80% of the children permanently excluded were known to children's social care in the previous 6 years. More than 50% of children who were permanently excluded or suspended from school had low rates of school attendance, special educational needs and disabilities, and or are eligible for free school meals or the pupil premium. Children were at a much greater risk of being suspended or permanently excluded when they made the transition from primary into secondary school. Children who were excluded or suspended are more likely to live in the areas of the city with high levels of deprivation. So what are we actually doing about this? Well, first of all, we are collaborating with our schools to avoid permanent exclusions. Last year, 43 exclusions were prevented through our partnership work with our schools. We have a robust escalation procedures to prevent primary permanent exclusions. And since its implementation in the summer term of 2024, there have been no primary permanent exclusions. So there is an example of positive impact. An offer for schools to prevent the permanent exclusions of pupils engaging in the vaping of illegal substances. And since that implementation in April 2024, there have been no permanent exclusions for vaping of substances controlled under the Misuse of Drugs Act. Again, we're seeing an impact there, and I have to say a particular thanks to Dave Schwartz and his team, who have worked so effectively and engaged so well with our head teachers, senior leaders, and our schools. Looking ahead, a combination of system change projects, which include the SEND improvement strategy, which you're all quite familiar with, our place-based working group, and Plymouth City Council system leadership projects are driving our collective ambition, which is to reduce the rates of permanent exclusion and suspension. Some highlights of this work I'd like to share with you. A new early language acquisition project. This will support the development of children's language so they're better able to communicate within their setting, reducing the behaviours that may well increase the risk of exclusion. We all know that if children or young people find it more difficult to express their views and to use language effectively, it is more likely to result in behaviours which they can't actually express and explain. A new vulnerable pupils panel. The panel is a partnership between education, health, police and children's social care, providing early help and prevention to support children and remove barriers to their access and engagement with education. And also a new special schools outreach offer, providing specialist advice and support to professionals who are in mainstream schools so then they can be equipped to meet the needs of children who have complex needs and cohorts within their schools. And this is really important work of our mainstream schools working in fact and supported with our special schools and the outreach work. I would stress that these are really important developments, and what's really important about them is this is early intervention, and we know that early intervention results in long-term advantage. Thank you very much indeed.
Thank you, Councillor Cresswell. Lisa, would anybody like to speak? No?
No, that covered everything, and I'm obviously happy to take questions, as are my head teacher colleagues.
Thank you very much. This is a real passion of mine, and I'm so glad that it was brought here, and it was a really good report, so thank you. I do have a couple of questions that I'm just going to abuse my position and take first, if that's okay. So, Councillor Cresswell stated that permanent exclusions in primary schools there were none. And I wonder if it's possible to understand the difference between primary and secondary, and are we using a trauma-informed approach to see how far those secondary school students are in their journey?
I think that as a local authority, we have been working, and that's very important in terms of some of the things like the place-based approach and the way that we have been working with our with all of our schools, and schools are aware of the fact that we are, and schools actually implement the trauma-informed approach, and is in all circumstances. Some schools will be further along that journey than others are. I think it might be worthwhile perhaps hearing as well from some of our secondary, particularly our secondary heads and also our primary heads, because I know, having been into quite a few of these schools, the different models that they have in terms of behaviour and relationships and such within schools, and it might be really interesting to share their actual practice and experience.
Sean, would you like to speak to this?
Yeah, I'm happy to start. I think in terms of the trauma-informed approach across schools, you know, there's been a city-wide, I think, commitment in terms of all schools taking on what we call TIS training. And as a result of that, all our staff are all well-versed and well-informed around the adaptations to approaching children and their behaviours. We see behaviour as a form of communication. I think it's probably fair to say that most schools, I'm talking from my own experience here, have made adaptations to their behaviour policies or behaviour and relationship policies to ensure that all children are supported with the trauma-informed practice sitting, you know, at the heart of it. We we currently have adapted our practices to ensure that children are supported in a very therapeutic way. So that could be both with the resources that we have within our own primary schools or resources that sit outside of it. And it's all based on allowing the children time to reflect and engage in the support mechanisms that surround the behaviours to prevent them from escalating any further, which could then result in a permanent exclusion. What that looks like in secondary schools, I'll probably be leaning on Anita and Rob and Scott to articulate, but over the last sort of 2 years, fair to say that citywide training has been undertaken with that trauma-informed practice for primary school practitioners. And there is a level of commitment to adopting them and living them through our daily practice. I guess the next steps are to look at evaluating where there are variances to that and what next steps can be adopted.
Thank you very much, Sean.
Please, because this is actually something that I'm incredibly passionate about. So at Lipson Vale Primary School, we embarked on quite a significant journey as a staff a couple of years ago, and we abandoned, I use that word purposefully, a behaviour policy and introduced a purely relationship-based policy, and it is called our relationships policy. It's fully rooted in a trauma-informed approach to school, and it's very much built on the culture that all staff adopt as being a staff member of Lipson Vale Primary School, and it's also included as part of our induction package. So all new members of staff have a day's worth of trauma-informed training, so they understand the purpose and where our policy has come from and where it's built up from. The approach at Lipson Vale Primary School, which is fully supported by the local authority, and definitely when we speak to other colleagues, they talk equally passionately about a trauma-informed approach in their schools. It's very much based on relationships and having those secure relationships with our children, and recognising that whilst not all children come into school with trauma on a daily basis, we must recognise that every child's experience in the morning is entirely different. One of the most powerful tools that we introduced was something called the window of tolerance, and we educate our children from reception, as soon as they start our school, that everybody has a window of tolerance, but that changes based on the experiences that you have outside of school and within school. And we teach them about how to communicate with their appropriate trusted adults when they are feeling outside of their window. And we use scientific language with them, like hypervigilance and hypovigilance with them, and recognizing those feelings that we have in our bodies to be able to give them the communication skills to articulate that they are needing some intervention. And then from that, we look at restorative approaches in school and how we can support children through education to understand why they're feeling that way and whether how their behaviours are impacting on their day-to-day life. We talk about consequences religiously with our children, and we talk about them from both positive and positive actions result in positive consequences, negative actions result in negative consequences. But we see all children, irrespective of the behaviour they're demonstrating, as partners in that. So it's done through those secure relationships that they have with adults, and all children have a key adult or key adults around them throughout the day. In terms of this helping us reduce suspensions and permanent exclusions, what I always say to my colleagues that it's a trauma-informed approach, like the one we've adopted at Lipson Vale, is a longer-term game, I guess, in terms of you have to be able to develop those secure relationships with those children, and the children have to be able to trust that you are an adult that's got their best interests at heart. We have had some real success stories. This is my 5th year at Lipson Vale Primary School, and when I started, we were demonstrated with quite some significant challenging behaviour from our children. That we kept those children in school. We did have to suspend them at times because the behaviour they demonstrate put the safety of staff and children at risk. However, we kept them in terms of not wanting them, not permanently excluding them, and they've all successfully transitioned into secondary school with a very thorough enhanced transition package for them. And so when we reflect back on that journey that our school, that Lips and Vale Primary School has been on, it's been one of significant learning, significant reflection, but we are seeing those real positive gains that are coming out now. But it has been a long game and one that we've stuck with. But I'm fortunate because the school, my staff, through the training and induction, the staff are very passionate about also believing that this is something that is right for our children and our community.
Thank you so much. That was incredible. I have Councillor Stevens. Sorry.
Okay, thank you. To Peter and to Sean for giving us that primary perspective. Because in the report, one of the reports later on, it says for elective home education, excuse me, it says a more flexible approach to the curriculum at school may prevent children being withdrawn to home education at Key Stage 4. And my question is, can a more flexible approach to the curriculum at Key Stage 1, 2 and 3 prevent more children being at risk of suspension or permanent exclusion? Because there's a lot in our report about factors, characteristics of children, but there's very little in the report about the provision that children have to be exposed to. And for many children, it's the right provision. For some, it's a barrier. So I don't know if our primary colleagues are able to mention that. Would that be okay? And then what is it like from a local authority perspective?
Peter?
Could I just ask, I don't know if this is appropriate, but could I just ask for sort of like that sort of nurturing approach and could I ask Scott, do you think you could possibly come in there and particularly talk and enhance on some of that work that you're setting up in terms of the Burrington Hub, which might be appropriate to bring in there at this particular time?
I'd love to. I don't know how it works in terms of just chairing. If Councillor Stevens has just raised a point, am I okay to respond to a different one?
Please do, Scott. That's fine.
Right. Okay. So I think, firstly, I just really want to thank all of you for this meeting. I think it is about time that we all talk. And if we look at permanent exclusion, for me, it's a bit like a runny nose. So you can look at a permanent exclusion and say it's got a problem with the nose, but actually we know that it's a symptom often of a much wider issue in the body. And permanent exclusion is just like that. A rise in permanent exclusion is not just an issue with schools, but it is an issue with communities. And that sort of leads to what Councillor Cresswell was talking about. So we've been very lucky at All Saints in that with the backing of the TEDRAG Trust and our South West Opportunities Fund, we've developed a community hub. It is in the basis of the belief that happy communities produce happy children and happy children don't get permanently excluded. And I think when we look at solutions to permanent exclusion, we actually have to need to look intergenerationally. We are very, again, privileged at All Saints that a lot of our children's parents came to All Saints, their grandparents came to All Saints in different forms, and that allows us to see that these conditions for permanent exclusion actually have existed previously in different guises. And we're dealing with intergenerational issues here that we have to work together on. The Community Hub serves to enable our community to flourish. So it's not school directed, it is school funded, but we employ full-time a community engagement officer, and the community through sort of deep listening campaigns comes to us, talks to us about common themes, common stresses, and then we try to link them up with third-party agencies, people in the charitable arm, to help decrease the stress in our local environment. That is producing some really useful data as a school. And what the stresses and the concerns for our local community are and how we can help. I don't know whether that is sufficient or whether we've got questions on that.
Thank you, Scott. Before we continue, I just wanted to address your question about the chairing. So any questions or comments should come through the chair. Raise your hand at any point in time if you wish to speak, and I'm sure if I don't see you, someone next to me will, and I will get to you. So I'm going to go back to Councillor Stevens' question, if that's okay, just before he forgets what he was asking and who he was asking it to. Is that okay, Scott? Thank you. Councillor Stevens.
Okay, let me remember my question. Yeah, In a later paper, it says a more flexible approach to the curriculum at school may prevent children being withdrawn to home education at Key Stage 4. My question is to Isabel, and thank you for the detailed report your team have presented as well, and to primary colleagues here. Can a more flexible approach to the curriculum at school prevent children in primary schools at Key Stage 1 and 2 being at risk of being suspended or permanently excluded?
I think that flexibility is absolutely key in terms of exclusion prevention. I think that primary schools are incredibly flexible, actually, and that's why we see the low rates of permanent exclusion that we do. And it's exactly as Peter and Sean have described in terms of the, I think, being smaller in size, they're able to invest the time to build those relationships. I think that the evidence is that a relationships-based model and approach to working with children and families is absolutely key throughout the entire child's journey, whether that be through early years, primary or secondary. What we know about our secondary children, you referred to the home education report. Lots of those Key Stage 4 students are leaving because they can access that very flexible provision, that vocational-based provision at the City College. Now, that feeds into the work of the place-based working group because there is the pre-16 vocational or pre-16 offer that they're looking to develop to provide greater flexibility across our secondary schools because we recognise that there is a need there. Additionally to that, the 3-tier alternative provision strategy is another key feature within our approach because, nationally, I think all of the evidence points to flexible provision that meets the needs of children, that gives parents confidence and that gives children confidence and feel like they're being heard and listened to and having their needs met, and it's like the right support, right place, right time. If that runs through at their times of need and that's understood, then that will provide the conditions for success for some of our really vulnerable children. So I think your question is a very important one. And as a city and a partnership, we recognise that those are the things that we need to work on together.
Thank you very much, Isabel. A supplementary?
Yeah, a supplementary, because I like, thanks for your response, and I like the sharing today of the trauma-informed practice for every child, whatever their level of resilience is. But for some children who come to school who may have vulnerabilities and circumstances beyond the school gate that don't disappear once they've crossed the threshold, how much capacity does a school have to kind of say, right then, at this moment in time, supporting these children with their social and emotional health needs is more important than some of the curriculum that is prescribed for their year group? Is that something Peter might answer, or Sean, that can be implemented easily?
Happy to answer that, Chair. When we talk about things being implemented easily, I think we just need to be brave, actually, and address the needs as they stand before us. I'm talking from my own perspective now, but we have daily check-ins with our children every day. We have a family support advisor. We're fortunate to have that. But when we identify need, we make those adaptations to the curriculum because children won't learn well and stay in school unless they feel good. So there is that trade-off of making sure that when children are in school, we do our best to make them feel good, and that can be just with a trusted adult checking in with them, or it could be making those alterations to their curriculum time, whether they're in the classroom or outside of the classroom. We want our children to just be in school because we know that's the best place for them. So we are flexible. We do make those flexible arrangements. It could be that we're allowing them to be, we get animals into the school. They're allowed to work with the animals, for example. We have soft starts so they can come in early and get on with things quietly in the classroom before everybody else comes in, because that causes them anxiety. We have learning mentors here, for example, that might then dedicate some time to have some one-to-one time or group therapy time with those children. So I think In terms of internally, yes, we're really, really flexible with our approaches. I think the next steps then are looking, and we know there are some positive plans ahead for us looking at alternative provision and hubs for AP sort of provision for us to extend that offer beyond our own school premises, into alternative hubs that will be able to sort of complement the work that we do in schools.
Thank you very much, and I won't bring Scott in. I just wonder, though, we've heard from 2 primary schools, but being someone who works with teenagers at the higher end of teenage years, is it easy to get primary school children with animals or, to sit and colour? I know that colouring with a 10-year-old is far easier than asking an 18-year-old or a 16-year-old to colour in. So I wonder how this works when we move into secondary school, because presumably secondary school is where we lose a lot of our children. Thank you. Scott, would you like to come in?
It really comes in to that point, and I can only talk for All Saints here. I just think we need to be really careful about that word trauma and understand that schools can only be therapeutic places up to a point, and the levels of trauma that we are seeing are not, we're the first aid when really what we need is minimum accident and emergency rooms in terms of trauma. So we are dealing with long-term domestic violence, we're dealing with alcohol abuse, substance abuse in the home, we're dealing with often cases that have been moved down from child protection to child in need, where parents decide that they don't want to engage with child in need. And it is really complicated because each one of those children are incredibly vulnerable. And I think, realistically, the resources that schools have got to tackle and support those pupils are really tight. At the same time as other services in the local authority have also had their belts tightened. And it's no wonder that it's the children with the most vulnerabilities that, have real significant trauma that are the ones that are coming out with the symptoms of behaviours that are really dangerous. That is where we as head teachers have to make really difficult decisions about whether we are the right places to be offering this therapeutic support, because some of these children need really intense therapeutic support that go way beyond what normal mainstream is able to offer within the resources that we have.
Thank you, Scott. I fully agree with you. I have Councillor Beer.
Thank you, Chair. First of all, I'm going to be a bit pedantic and actually draw people's attention to page 15 of the report, 4.10. School is spelled S-C-H-O-L. That's just me being a bit pedantic. I'm dyslexic, so I've got terrible spelling, but somebody's obviously missed out a 0 or a 0 in that. My question really is in around anxiety and depression of young people, particularly at senior school age, who actually have a fear of going to school because of things that happen within the school environment that cause that fear in them. And those children tend to either become behavioural bad in school and then be excluded. What support's in place for children like that across Plymouth? Because I'm very aware in my 2 senior schools in Plympton of children that don't go to school because they suffer anxiety and depression and they can't physically anymore go over the threshold of the school playground. So I'm really concerned about that particular issue and how we deal with it and why those children aren't in school and how some of that behaviour leads to exclusion. Thank you, Chair.
Thank you, Councillor Beer. Who would like to take Councillor Cresswell?
I was going to say, do you want to be in? Perhaps Anita might be happy to answer that question.
Anita, are you happy to speak?
Yeah, absolutely. So yeah, there certainly are quite a number of children that are school refusers and do suffer from anxiety. Many of the issues, start much earlier than secondary school, and I think some of the things is around the time that it takes for them to get the diagnoses that they need or CAM support that they need, which is extensive medical support that those young people need in order to support them. There's lots of attachment issues for sure because of the concerns that they have around leaving the family home, which therefore do lead around that level of anxiety. Certainly within schools, we have a whole range of welfare support that we offer to young people, learning mentors, counsellors. So, for example, one of the things that we have invested in quite heavily this year, we have a minibus that goes out in the morning that collects children, which obviously is a support in terms of them getting into school, but also that friendly face that from doorstep to school. We have an outreach worker that goes in and builds those relationships with young people in the home. And therefore, when they come into school, they recognise that face and work with them. And then once we get them into school, it's around what that looks like, because no child, once they get across that threshold after you've done significant work with them in the home to support them, is going to go straight into a classroom with 30 children. So what does the curriculum look like for that young person? They will have significant gaps in their learning that need to be addressed, self-esteem programs that we have on offer, and really the person that's going to be the person that welcomes them every day, that the adjustments are made to their curriculum or what their day looks like, adjusted timetables, and really someone for them to talk to, which I know we've talked about before. But for a lot of those young people with extreme anxieties, it's normally more than school that's causing those anxieties, and it's around having the experts in place that can do those pieces of work with those young people, which actually sit very much outside the skill set of teachers that are trained to be teaching. And so yes, of course, we employ the support staff with a range of skills, mental health nurses, all sorts of things. But they come at a significant cost, and there are only certain reasonable adjustments that can be made to a child's education for an extensive period of time. There are lots of AP providers out there. We do use AP provision for many of our young students. We have nurture provision, we have an ASC unit, and certainly we know that when they've got significant gaps in their learning, that an adapted curriculum is exactly what they need, and they come at significant costs, which we don't necessarily have in schools with the budgets that we have. So when we come to making reasonable adjustments, what schools can't do is make unreasonable adjustments for a young person.
Thank you very much, Anita.
Yeah. Can I come in? Because you mentioned the initials AP, and I looked across the panel here and a few blank faces not knowing what that means. So could you explain that? And also, do you share your best practice with other heads in senior schools across Plymouth so that there is a learning from that? Because in my experience, I've not known that happen in Plimpton schools. Thank you.
Thank you, Terry.
Yeah, absolutely. So AP stands for alternative provision, and that can come in lots of different ways. It can be provided by another provider, but also many schools now, particularly secondary, and I know Scott is much further ahead than I am, in terms of setting up their own AP provision. And the alternative provision then runs a separate curriculum, might include additional English and maths provision, forest school, a different timing of the school day, a much smaller environment with specialist team of people. And you can set up AP provision. Scott and I were only talking yesterday afternoon about his AP provision, and my staff going over to have a look at his AP provision so that we can learn from each other for sure. The training across the city, there has been substantial training across the city. We have at different conferences heard about different schools attendance systems. For example, I think we heard from Hills not so long ago at some of the strategies that they have been using to improve attendance for their young people. And certainly, all of the trauma informed and the ACE training that has happened across schools. And what's lovely is how a lot of the trusts are working together. We've recently ran some training around parental mental health and the impact of parental mental health on young people. And there were schools across the city who sent their pastoral teams to come and listen to that. So certainly when we've brought down some really expert speakers, Dr. Kevin Rowland, for example, Dr. Alan Cooklan, when we've got some real Warren Larkin around the ACE training, certainly other schools have come together and joined that training.
Thank you, Anita. I'm going to move on to Councillor Gilmore.
Thank you, Chair. Yeah, thank you, Anita, because you've started to touch on what I wanted to ask about. I feel, with all due respect, that we're slightly missing the point at the moment. I have a teaching background, and I completely appreciate the points that all the heads have made about the difficulties of working with some young people. But surely our point, and I'm referring here to 2.1 and 2.2 on page 13 and 12.3 on page 25, which is that the numbers in Plymouth are double the national average for suspensions and exclusions. These issues facing children and families, fragmentation, poverty, trauma, they are national problems. So the question is why is Plymouth dealing with it in terms of exclusions so badly compared to the rest of the country? So talking about getting best practice around the city and the region is terrific, but I'm wondering if there's attempts to get best practice from around the country. And my real point that I wanted to make is we've talked a lot about primary, but we've got several heads here from multi-academy trusts, from the MATs, and I would like to know when children, young people, students are excluded in a MAT, are they going outside of it completely, or is the MAT taking responsibility for them and keeping them within the trust somehow? And second to that idea of keeping them in and taking responsibility, when a child goes into, for example, reset in school, how much energy is being put into making sure their education doesn't fall behind? Because everyone in this room with a teaching background is going to nod and agree with me that the more lessons a student misses, the worse behaved they are when they come back, and the more they've inched towards being suspended or excluded. So, MATs, are you keeping them within your trust when you suspend or exclude them? All heads in secondary, are you keeping their education up to speed while they're out of the classroom so they've got a better chance? And everybody, are we searching for best practice outside the region in the areas that are doing so much better than we are? Thank you, Chair, for letting me ask
Thank you very much,
long question. I won't do it again.
Could I please bring in Rob, who's leading the place-based working group, which is leading on inclusion? Is that okay?
Yeah, more than happy to. In answer to some of those questions, obviously I can't talk about every multi-academy trust, but the ones that I am aware of, yes, there is a real intention for multi-academy trusts to look after the children from within their trust. So I know, for example, within the trust that I work in, the TEDRAG Trust, we've got 4 secondary schools in Plymouth. So it is not uncommon when we are in a difficult situation with a young person to try and seek a solution at another one of our schools. Obviously, we have to take into account parental views and preferences, but that is always the intention, to try to look for an internal solution within our trust. We also have set up throughout Plymouth various panels, such as vulnerable pupil panels. I know Anita sits on one of those, which is carefully consider individual cases and appropriate solutions for that young person. The goal is always to try and get children back back into school as quickly as possible in a place where we feel that they can succeed. I think you are right about there are definitely some acute issues within the city. So although all the trends that you see in Plymouth, they are national, and the national reasons equally apply in Plymouth, but there also appears to be the rates in Plymouth are exceeding some of those national average rates. Now, it's interesting when we get into the data. So although when you look at the paper that's been presented and you take the data there, clearly the issue is more concentrated in secondary. However, the patterns that exist within secondary, albeit at much lower levels, do start to manifest themselves within primary. And we've been doing a bit of work of looking at the different areas of the city. So if you divide the city up into the 4 sectors of north, east, south and west, and you map those with levels of deprivation, what you see is a correlation at both primary and secondary, where the schools that serve the communities with the highest levels of deprivation have the highest levels of suspension, permanent exclusion, elective home education, rates of absence, etc. Now, having worked in different areas of the city, so I historically was a secondary head teacher in the eastern side of the city, which is the least deprived sector of Plymouth. And in that area, exclusions, etc., are considerably lower and are at the lowest rates of anywhere in the city. I now work with schools in the western and northern areas of the city, which are the most deprived areas. What I can say is, what I see is really fantastic practice, real investment into trying to make the difference with these young people. But I think we've got an issue in Plymouth, which is around this idea of connection and belonging. So although some of these trends existed pre-pandemic, what we've seen is over the lockdown periods, there has been a bit of a fracturing of the social contract that perhaps existed between families, communities, schools, etc., before the pandemic, which is now, I think, a bit more fractured, and that we've got to do a lot of work around what I would call building a stronger connection and belonging with those communities, with those families. So within the place-based work, we're specifically looking at, okay, what are some of the strategies that we can develop in the city that are going to tackle some of the underlying contributing factors to why we're seeing the spike in suspensions and permanent exclusions. So our 6 strategies are, first of all, is to work on supporting schools to build this connection and belonging. We know that primary schools are much stronger at this than secondary. A big part of that is the interactions, I think, between parents and the community, because of the collecting of children from school and the interactions with school staff. That's not something that we have in the same way at secondary. So there is a lot, I think, that secondaries can learn from primary colleagues there. But we're also working with Plymouth University, Marjon's University, and looking at some of the really fantastic research from around the country of where local authorities and schools and trusts have really been successful in this area. The second thing is around Tier 2 support. So as Anita referred to, there are pockets of really fantastic practice around the city where schools have built an offer for their young people where it bridges the gap between the universal offer for all children and the point where the school might be seeking some external support, such as an alternative provider. So it is supporting schools to really build a high quality tier 2 support for the most vulnerable children within their schools. The third thing which Councillor Cresswell spoke about was this early language acquisition project and the importance of supporting children from early years and in reception to build a strong vocabulary, because we know that the stronger a child's vocabulary, the greater their capacity to learn. And we also know their greater capacity to learn, the more likely it is they'll be successful in school and less likely to, be subject to suspensions and so on. The fourth thing is around enhanced transition and making sure that the transition between all phases, so this is between reception, early years into Key Stage 1, Key Stage 2 into Key Stage 3, Key Stage 3 into 4 and 4 into 5, and making sure that that transition is really strong. Working with public health around the issue of vaping, and then in collaboration with City College Plymouth and ACE, building a really good quality pre-16 offer. So we know that the still the current education policy, but we know that it will change. But there has been obviously a real emphasis in secondary around EBAC and a rigorous academic curriculum. And, and I think all of us inside this room believe in being, having really high aspirations for our young people, but I think it is also accepting that actually for some young people, that curriculum is not engaging them, and we need to have other options for them, which is not about taking them out of their school, but it might be that, they are focusing on English, maths, science, some of their core subjects in their school, but also able to access a vocational offer through a provider like City College Plymouth. And actually that engagement might just be the hook that keeps the child engaged in their education and wanting to complete it successfully. So that's the work of the place-based working group. We've got a conference on the 24th where we've got all school leaders in the city. What we're going to be doing this time is, rather than it focusing on secondary, is recognising that if we truly want to deal with these issues, it has to be cross-phased, it has to be cross-setting, it has to involve other agencies, because the reasons for the data is not solely down to what happens between 8:30 and 4 p.m. Monday to Friday during term time. It is a very complex issue, and I think if we can build that one team mindset in the city and bring everyone together, we've got a real shot at tackling this. Sorry, I will stop talking now. I realise I've been going on far too long.
Thank you very much. I didn't want to stop you. It was so interesting. I have Councillor Krisnak, and then I have Councillor Tippett, Councillor Wood, and I'm going to have to move on, I'm afraid.
Thank you, Madam Chair. One of the concerns for me is that looking at the report of the exclusion of the children from the mainstream education does not address the issue of the children that are being excluded from the school because of their haircut, their dress code. And I understand that some schools, even today, I came across the article where a child was excluded from the school because he has a medical condition, his hair had to be cut further up the hair, and he was excluded from the school because it did not sit together with the school policy of a dress code. And I think this kind of things do happen in our schools, and I just wonder how many of children in Plymouth are excluded from the main education because of these strict policies that academies and schools have in place. Thank you.
Before I pass that on, Councillor Krisnak, if you have a specific case, we'll take that after, if that's okay. But would anybody like to answer the question about rules of exclusion? Scott?
I'll go. I just don't recognise that. I just don't recognise that. So, firstly, exclusion, when we use the word exclusion, we mean permanent exclusion. And certainly, I don't know any trust that would warrant looking at that. If I tried to permanently exclude a child from not having the uniform within the TEDRAG trust, well, I wouldn't be in a job. it just wouldn't be allowed. In terms of like low-level suspensions around the news articles that you see around children who have been suspended for uniform and things like that, the uniform may have been the triggering incident, but what the suspension is probably for, if we're being charitable, is for the child's response to being challenged over something. Uniform policies are really important. Equity is really important in our schools. And if we're talking about attendance and getting children into school, I was one of the kids at school when it was non-school uniform day that really didn't want to go in because I couldn't compare with all the other kids' clothes. Like, uniform is really important, but I don't know anyone that's suspending because of uniform or because of a medical condition. I just can't see that happening, and I'd be really interested if there's case studies.
Thank you very much. I am going to quickly move on, sorry. Councillor Tippett.
Thank you, Chair. My question is about Appendix 9 on the drug and alcohol-related exclusions and suspensions. I couldn't believe it when I saw that it had doubled from 2022-23 to 23-24. And I was just wondering if there was any particular reason why that happened, if you understand across the city, if there was any trends that led to that, and is there any work being put in place to protect young people from being in the situation where they'd be suspended for these things?
Anita, would you like to come in on that?
Yeah, I'm very happy to come in on that. Probably not this summer, but the summer before, is schools suddenly experienced some significant issues around vaping containing THC and spice. It actually came as quite a shock to the whole system, actually, including the public health, in the fact the ease in which the children, for probably about £10, can get this substance. And what we saw was some significant medical responses to that. We have had to have A&E. We've had to call ambulances to some significantly poorly children as a result of taking these substances. Unlike cannabis use, it's very difficult to detect, and we suddenly saw a real big spike in schools. And in fact, actually, it was Stoke Damrell and Marine Academy working together that called in public health and said, we are going to have a child death if something isn't happening. Because it was the rise in the number of cases went through the roof, and children were bringing this into school, which we hadn't seen with cannabis and those sorts of substances, because the ease at which they can put them into vapes. Schools have responded with. All schools have a zero tolerance to drugs. You know, that will always be the case, because we cannot ever say it's okay to bring drugs onto the school site. Actually, we worked with public health and with the other schools to look at how we were going to address this, given that we had seen this extensive spike. Schools have, we've done quite a lot around. We wrote collectively to all parents the same letter from all of the schools to make parents are aware, who were also very unaware that this was very much a teenage issue that was becoming was at risk of really taking off and rocketing, and parents had not heard of it at that particular stage either. So we wrote collectively and said that we're going to be addressing this. So we've got things like we wand the children, so we check for vapes. This week, actually, police are now coming in and able to check vapes that are confiscated, and some of those deterrents keep that away from the school gates. But it is also about the education that comes alongside that. So police have done assemblies in all of the schools across Plymouth to the young people, talking about the dangers, but also the significant cases around that. We've also addressed what alternatives can we put in place. So for any young person with any substance, what Public Health were able to do was commission Sharp to be working with those young people. So, for example, if we have any young person who we know is utilising THC or spice, then actually there's a referral into Sharp, and they have a Sharp worker that works with them on drug addiction and those sorts of things. So I think we've had a citywide approach and response to what was starting to get very out of hand, and we have since seen a decline in that. And I think the deterrents that have been put in place in school, the education that's been provided to young people, they have seen at first hand the impact that that has had on their friends. And I think we have seen a decline in the number of children that are bringing that onto school site.
Thank you very much, Anita. And on the back of that, just before I bring Councillor Wood in, I just wanted to ask David a question, if that's okay, David. Looking at the data of this, it does look like there's an obvious link between exclusions and various levels of deprivation or disadvantage. And the levels of exclusions through drugs and violence are 81% known to social care. I wonder what we're doing as an authority to help these young people get the right help from our side.
Thank you, Councillor O'Reilly. So the report clearly demonstrates that there is a link between where children live in Plymouth and their level of exclusion and suspension, and indeed, when we go on to the next report shortly, electively home education. So that link is clearly set out there. The response to that, as some of the head teacher colleagues have said, and you can see how that's developing across the city, is in relation to that work within communities and with residents within the localities. So Scott's example, that is being worked at with colleagues across the local authority, with some of my colleagues from Early Help, for example, so that we can wrap our resources around much better and more strongly the children and families within those communities that need it. So a strong early help, early intervention and prevention offer and support at the earliest opportunity through a range of our resources, for example, the family hubs, the children's centres, working alongside our schools and ensuring that we have got the right resource in place at the right time to support our children and families. One of the strengths of Plymouth is that we have got lots of organisations, voluntary groups that are able to offer that support, and our next piece of work is about how we connect that better and how we really join that up, because by joining it up and providing a much more coherent response around our communities and around our families is going to result in addressing some of those root cause issues. Because this report does address some of those. What are the root cause issues that are causing children to be excluded or suspended from school? And we could pick this up also in the early help report that we've got later when Martine is here.
Thank you very much, David. Councillor Wood.
Thank you, Chair. A question towards David or Isabel. Noting the appendices appendices 1 and 2 on 28 and 29, we only go back as far with the data to the 2019-2020 years. It would be rather useful to have a comparator to those years which are properly pre-COVID, because of course end of 20 covered part of the COVID period. So it'd be useful to have the comparator years for maybe 10 years prior to see what those trends were. And it would also be rather useful, I would feel, if we weren't just comparing ourselves to England or to the southwest, but perhaps other regional cities that would be similar in their makeup to Plymouth, such as perhaps Exeter or Portsmouth. Could we see if that could be done, please?
Yeah, I'm more than happy to pick that up as an action and feedback.
Thank you very much, Isabel. I'm going to move on, if that's okay. The recommendation is to note the report. Is everybody okay with that? Councillor Cresswell.
Could I just end by saying thank you to the, and I'm sure you'll do that as well, but thank you to the heads for coming in and joining us, and to say that this is a very much a deep dive, and we recognise the challenges and the issues that we have, and it's a very complex, as heads have actually said, it's a very complex issue. It's wider than just schools, but I think what's really good, and the debate that we've had here and the discussion we've had here, we've been very we've asked deep questions, you've been open and transparent, the heads have been open and transparent, and really talked through what are in fact really complex issues. I think the really positives, and I want to take some positives out of here, is that there's very much that sort of the working together, working through the through our place-based working, is moving forward and sharing, and that's been a big emphasis this afternoon, has been sharing that good practice, because we're basically on a journey in terms of sharing good practice within our own schools in Plymouth, but also schools and areas from outside the local authority. And finally, if I could just say that I think one of the things that Rob brought up, which has actually been very much part of this and key thinking about this, is that interconnection and that sense of actually belonging, and that stronger connection of belonging, which has been very worked on very much by the place-based, by our place-based working group. And I think we've got a really positive basis here of really moving forward for the benefit of our children within our city. So thank you for indulging me, Councillor Bride.
Thank you very much, Councillor Creswell. I am going to move on to item number 7. Before I thank the head teachers, I would quite like you to stay for that, if that's possible. Would that be okay? Thank you very much. So I will thank you after. Elective home education, item 7. I'd like to hand over to Councillor Creswell, please.
Thank you very much, Councillor Riley. Thank you very much to the heads for agreeing to stay for another interesting and session in which your expertise will be very much appreciated. Introduction. Elective home education is a term used to describe a choice by parents to provide education for their child or their children at home instead of sending them to school. Educating a child full-time at home can be a very rewarding experience, but also can have a number of challenges as well. It's important that families who do elect to home educate are making a positive and also making an informed choice. Plymouth has seen a significant increase in the number of children being registered as home educated, and this trend is reflected nationally as well. The continuing rise in the number of children being withdrawn from school to be home educated is a concern in Plymouth, particularly for vulnerable children who might be in their secondary phase of education. The causal factors which lead to parents electing to home educate are often wide-ranging and complex. The rising numbers of vulnerable children being home educated must not be seen as an issue for schools in Plymouth City Council to deal with in isolation. It requires collaboration across the multi-agency partnerships and needs to hold families and outcomes for children at the centre. And I can't overemphasise this. These issues, these challenges we have, we will solve and work on together. They can't be seen in isolation. So what do we know about children who are home educated? We understand the challenges that children and families face prior to making the decisions to home educate. There has been a significant rise in the number of children with special educational needs who are being withdrawn for home education. Mental health and issues relating to a lack of parental confidence in how schools are supporting their child continue to be prevalent when looking at the reasons behind parental decisions to home educate. The majority of home educated children in Key Stage 4 attend the Plymouth City College provision. It provides an alternative to the formal national curriculum offer of mainstream secondary schools. 90% of children who are home educated were either severely absent or persistently absent from school before becoming home educated. And 37.44% of the children who have been known to children's social care within the previous 6 years. So again, we come back to best practice of what are we doing about it. We work collaboratively with families to monitor children who are home educated. We support children who are missing education to return to school as a result of our relational approach. Out of interest, last year, 153 children were supported to actually return to school. We continue to strengthen our partnership with families, schools, and across the multi-agencies to support vulnerable children to remain in school, and highlights of the work currently underway include working in partnership with the 3 Plymouth universities, which I think has been illustrated just previously in the last item, to undertake research project in home education. From the learning, we will create a preventative system to support children while they're in school. And the 3 universities being, of course, Plymouth University, Marjon, and also the Arts University. The development of a robust plan for home education. The plan's been approved by the Plymouth Education Board, and we measure our progress against key performance indicators on a monthly basis. Again, the place-based working group is developing a 3-tier alternative provision strategy, pre-16 vocational offer, and again coming back to that belonging framework to enable children to access to early help and a flexible curriculum offer in school. All schools have regular meetings and contact with their Link Early Help worker and allocated access and attendance officers to develop joint plans for children who have barriers to school attendance. Thank you, Councillor Riley.
Thank you very much, Councillor Cresswell. Would anybody else like to? Councillor McNamara.
Thank you, Chair. I'm quite fascinated with all these hundreds of children who are being educated at home. And obviously they're not a homogenous group. Do we have any idea, are there networks of parents working collaboratively to educate their children in small groups? Are there illegal faith-based schools? Or is every child sat at home in their own bedroom with a single parent educating them?
Councillor Cresswell.
That would be, you're right, it's not a homogenous group. There are some groups that have opted for elected home education who do actually meet in groups together and educate their children, and they meet up in groups and such. But the numbers of children that we're looking at, those would be a smaller, I would say, a smaller group of children. We, in fact, have we have data, I think, going back, which would reveal that the number of children who become electively home educated has increased considerably since, it goes back to COVID, since COVID. And there are particular groups of children who are more likely to become electively home educated. And those figures and those numbers have been going up significantly. If either David or Lisa, if there's anything you'd like to additionally add, or any of the heads, in fact. Sorry, Isabel.
Thank you. So to add to that answer, we do have home educators that will meet at kind of different events which are being hosted. So, for example, the Plymouth Marine Aquarium has sessions specifically for home educating families. So they are, the home education community are quite active on social media. They have a kind of closed Facebook page, and they will kind of promote events which families might be interested in attending. So they will, I know that they will meet together so that the children can meet with their friends and so on and so forth. So I'm not aware of any illegal schools in Plymouth which have come about as a result of home educating groups, and that's not something that I've become aware of. We do have a home education team who are building really good relationships with some of our families, and they hear about some of the great things that the home education community offer and does together. But it's, there are different families home educate for different reasons. So it's not to say that all of the home educated children have access to the same amazing opportunities as some of the other families. But we do promote as much as we can through our own Facebook webpage, where we promote certain things that families can access. But I know that they do communicate as a closed group to share resources and access to different exciting opportunities for their children.
Thank you very much, Isabel. I wonder if you could help me with who is responsible for monitoring the curriculum of the children who are home educated?
So the local authority is responsible for making sure that there are no children in their area who are missing education. All children are entitled to receive a suitable full-time education, and that's our job. There is no requirement for home educating families to provide evidence of the home education that they are providing, but if they don't share it with us, then we would be minded to consider that child might not be receiving any education. So it's in everyone's interest if we can work together to understand the provision that a child is receiving. So the duty falls on the local authority to make arrangements to know of any children in the local area who are not receiving a suitable education.
Thank you. And how often do we check that out? What's the process? And if young people aren't receiving an education at home, what's the process then?
So if a child isn't receiving a suitable education, then they are classed as a child missing education. They're no longer being home educated. So there's different processes depending on where the child sits. In Plymouth, our arrangements are, once we become aware that a child is going to be home educated or if a parent's intent to home educate, we will reach out to that parent and we will do an initial home visit. If we can, if they will allow us to come and meet with them, we will take them up on that opportunity, just to talk through the decision, to home educate, make sure that it's a positive and informed choice, and also just explore opportunities for that child to not come off the roll of the school, but maybe to return to school. So that's the first thing that we do, to understand what that parent's plan might be to provide a suitable education, and to also support them around the requirements of what a suitable home education might look like. After that, we will conduct a monitoring check within 3 months, and we will receive from the family kind of evidence, that initial kind of plan around what they're doing to educate their child at home, and also some information about what's actually been achieved so far and what next. If that's considered to be suitable, then the monitoring is annual after that, and that is the expectation set out by the Department for Education. Again, it goes back to that original point that I made, that families don't have to engage with that process, but it makes sense for them to do so because it stops it becoming really complicated further down the line. Now, what we do have is a brilliant home education team who are, like I say, building really good relationships with our home education community. We receive daily, so they're being contacted more and more by home educating families for advice around, what families might do to enhance their home education curriculum and provision. Wherever there is an opportunity for them to conduct a home visit and engage with families and see children, they will do that. But that's kind of, we rely on families reaching out to us. However, we do also receive public protection notices from the police on a daily basis. So if we have any for children who are electively home educated and there are concerns, we will, where we feel it's appropriate and that there's a need, we may conduct a home visit just to make sure that the family are okay, see if we can offer any additional support. So all the way through, we're trying to gather information, intelligence about families. If we hear from multi-agency partners or children's social care that there might be something to be worried about, or sometimes we'll get contacts from, health professionals. So, health visitors. Sometimes we'll receive calls from health visitors making inquiries about a family where they understood that a child is home educated. So we'll gather that information intelligence and decide our next course of action and whether or not we need to intervene before that 12-month period to make sure that home education is still suitable, because it's not just about the provision of education, it's also around the suitability of the environment for that child to receive their education.
Thank you very much. That was a really good answer. I have loads of questions which I'll take another time, but I do just want to double check. It is something that's a guideline that we do an annual check, but is it within our gift to potentially do it more often than that, or are we completely tied by what the national guideline is?
We could do it more than that, but the expectation is that it's light touch if the home education is suitable. So we always try to do more where families will, where they want us to. We'll always try and do more. But we don't have the, at the moment we don't have the resource to do over and above that. But we have started to host information, advice and guidance sessions where families are coming along. We're going to be reviewing the home education guidance for families with the home educating group. So we try to create opportunities to engage with home educators as much as we possibly can. And that's just going from strength to strength as we've started to build those relationships.
Thank you very much. Lisa.
I think it's important to note in relation to that relational practice that's being described to you there, that we know that that approach is working, because when we look at the significant number of families where we had concerns about the suitability of the education and we worked with them to return them to school, the large majority of those were done through that relational practice without having to resort to more punitive measures such as attendance, school attendance orders. We had very, very few actually that had to be pursued in that way. And so that relational practice to support and guide families and then help them back into school if that's the best route for those children has been working very well.
Thank you, Lisa. I have Councillor Beer.
I'm going to start by telling you a bit of a story, Chair, and then I'm going to ask my question.
I am sorry, we are already over this particular item, so if we can keep our questions concise, that would be amazing.
Absolutely. So just to tell you the brief story, 2 children, one does horse riding and equestrian all day, every day, and would be in her 3rd year at senior school. Another child sat at home all day in his bedroom playing on his computer games, both home educated children. So how robust is this monitoring? Because for those 2 children, it doesn't seem robust enough.
Thank you, Isabel.
So we have a framework against which we assess suitability, and and that is robust. We've shared it as best practice and it's been received as best practice by other local authorities. However, those monitoring visits that are annual are not, unless we're invited to visit families at home, are received via email. It's a report. So we have to go on what is being written within the report and measure, against a measure using our criteria, what's written in the report. Okay, so we don't always see for ourselves what is going on in a child's life by visiting them at home, because we have to be invited to do that. Where we have intelligence that will tell us that what is written in a report is not what is actually happening in real life, we will use that as a reason to go and conduct a home visit, or we will ask for exact samples of work to be provided to us, and we have had some of those cases, and we have ended up going down a school attendance order route for those families where it's been really tricky to get to the bottom of what's been actually going on for a child. So it is difficult. It's much easier if we can go and see children where they are and see for ourselves what resources they have access to, and talk to the child and get the child's view on what's going on for them. That's obviously always the best case scenario. But unfortunately, with the constraints of the legislation around home education, which is very much in the favour of home educators, it's very difficult for us to have access to really see what's happening unless we're invited into the home.
Thank you very much, Isabel. Lisa.
If I can just add to that in relation to the Department for Education guidance and give an example, home educators are able to educate their children at home in whichever way they see fit. And that includes, for example, something called unschooling, which is where the child is enabled to fully break from any form of education. That may be that then they are pursuing their interest in gaming, for example, and that when they are ready and showing an interest, then they will engage in a form of education at home. And so some home educators do follow that that pathway, and we have to, as a local authority, navigate that in our relationship with the family in terms of understanding why they might be pursuing that type of education at that time.
Thank you very much, Lisa. I have Councillor Krisnak, Councillor Macleay, Councillor Stevens, Councillor Gilmore and Councillor Wood. And we are quite over, so I wonder if anybody is happy to send an email to Isabel for their answer. If not, obviously, I will take your question on the floor, that's fine. I'm happy to do that if everyone's happy to do that.
Quickie, Chair, is that okay if I ask my question now? Is there an intergenerational, on-generational link to homeschooling where maybe the parents had poor attendance themselves? And also, is there a case sometimes where the child may be at home, or the parent might have chosen for the child to be home educated because of the parents' needs? And how do you handle situations that might arise because of that reason?
So in terms of the intergenerational kind of connections, we do have some home educators that were home educated themselves, and their decision to home educate their own children is very much kind of based on their philosophy of education. And that's more the more traditional kind of cohort that we've seen, you know, prior to the COVID pandemic. I think that the report highlights the level of vulnerability within the families, within many of the families where children are being home educated at the moment. So I think that those things, I mean, I haven't got any evidence or data on what the attendance of the parents were at school and so on and so forth. However, we do know that for some of our families, the parents don't necessarily believe in what the schools have to offer, or that they're struggling themselves to navigate some really complicated and complex circumstances for their own children around mental health or around risk of exclusion, or just struggling to get their children into school. So I think that you get really different reasons for home education and very different types of family who are home educating. So I don't have quantitative data to answer your question, but that's the intelligence that we have.
Okay. Lisa.
We would be very happy to run a session for any councillors who are interested, where we would just be able to talk through all of the details of how home education works, how we monitor. We can take the questions that haven't been answered, because I know it's not the same engaging with a question by email. So if that would be useful, we're very happy to do that on a more in a more informal format than this. I'm getting lots of nods.
Would members be agreeable to that? Elliot, could you note that, please?
Yeah, noted. Thank you, Chair.
Is there anybody that wants to ask another question, or shall we? Councillor Gilmore.
Sorry, everybody. I'm finding this really hard to understand. We're calling something home education, which can look like studying at home and going for trips to the aquarium, which is like school but at home, but can also look like going out doing your hobby all day, whether it's an outdoors hobby or gaming. It's not pursuing an interest in gaming. It's sitting at home playing on the Xbox. That's what that is. And I understand that to be called neglect. That's my understanding of that word, speaking as a parent. I have a legal responsibility to send my son to school. I do. If I've got an issue with the way the school are educating him, I've got a right to email them. And sorry, heads, I am one of them. I do email. We've got children out there being home educated, we're calling it. I'm hearing a euphemism. I'm sorry to be so blunt, but that's what I'm hearing. And there is a way of checking if it works or not. It's no good for individual children because, newsflash, they get older every year. But we could check their exam results, and we could check them against the average in Plymouth's exam results. But by that point, of course, it's year 11, they've finished statutory, whatever. Do home educated children pass their GCSEs and their A-levels at a rate that's comparable to the ones in school? And I think that's the only question I can formulate. I'm really quite shocked at what I've heard in the last half an hour. I'll have to stop talking. I don't think I can stop.
Thank you, Councillor Gilmore. I've just spoken to David, and I do think this is... I have lots of questions myself, and there is just no time for it. So I do wonder if Lisa's... Please do.
I'm just looking at this from a slightly different perspective, and thank you for indulging me. It's a very short question, and it should require a very short answer. How confident are you that you're operating within the government guidance around elective home education and the safeguarding that you do around that?
Well,
okay, so when we have our regional forums with our home education group of other local authorities, we are providing over and above what many other authorities are providing. Thank you.
Lisa.
So 100% confident, and that was represented in the ILACS inspection.
Councillor Creswell, did you want to speak?
I was thinking, I think because of the way the discussion's actually going, I think the recommendation, suggestion from Lisa would actually be really, really helpful. And it's something that we might want to include perhaps people not necessarily just on children's scrutiny, but might be quite positive to actually help to unpick and look in more detail about elective home education in its wider sense, because mainly the paper is much more looking at the data and the changes in elective home education and how this also relates into something we've been discussing earlier as well in terms of exclusion attendance and such. So I think it would be a really useful thing to actually have a look in more detail at the whole issue of elective home education, so that members perhaps had a better understanding and could and I think that would perhaps answer a lot of the questions that people are asking at the moment, if that seems agreeable.
I fully agree with that. I'm agreeable with that. Is everybody else agreeable with that? Thank you very much. We are asked to note the report. Thank you. Moving on to, thank you to the head teachers in the room. Thank you very much for coming and giving us your time. And hopefully we will see you soon. Thank you very much.
Thank you.
Moving on to agenda item 8, Children, Young People and Families Service Improvement Plan. Can I please hand over to Councillor Lang to introduce the report?
Thank you, Chair. The improvement plan, as you know, was developed following the ILACS inspection and aligns with the strategic priorities of the Achieving Excellence Plan for 2024-27. The report in your pack provides a comprehensive update on the progress made from May to July 2024 in enhancing the quality, the timeliness and outcomes of children's social care services here in Plymouth. This report also outlines the key achievements, challenges and priorities for the coming quarter. The report looks at progress on critical areas around the out-of-hours service, the Children's Disability Service, the LADO, which is the Local Authority Designated Officer, unaccompanied asylum-seeking children, which you'll see referred to as UASC, targeted help and front door services, timely and effective social work practice, good experiences and progress for children in care, leadership and management. And you'll have read about the ongoing efforts to stabilise and improve services with a strong emphasis on partnership working, quality assurance and continuous improvement to ensure the very best outcomes for children and young people in Plymouth. I'm going to hand over to you, Temi. Are you going to take us through the report?
Temi?
Yes, so I'll take the report as read, but just draw out some key highlights within the report. So if we start with our unaccompanied asylum seeking team and the work that we're doing around that area. I think we should be really proud because actually our support to those children, young people has really improved, our quality of intervention, making sure that we are offering a really considerate service to them given the trauma that they have experienced, and there's still ongoing work with that team, particularly around the advocacy service that we're trying to implement, but that's a real strength. Equally, just to highlight within the report some of the work we've been doing around our social work assessments and improving the quality of the assessments that we're doing, making sure that assessments take into consideration all factors to ensure families aren't experiencing repeat patterns. Also to highlight the strengthening up of our out-of-hours service. That's a really critical area and our practice has really seen significant improvements. There's still some areas where we know there is ongoing work, and some of that looks like how we stabilise our workforce to make sure that all of the work that we've been doing can really cement with our current workforce. Equally, some of the areas that we know we need to turn the tide on is our support for children, young people who are not in any education, employment or training. And also what we know that we want to keep improving on is around our supervisions and quality of supervision. So I'm happy to take any questions to the report.
Councillor Steele.
Thanks for that. It was very helpful. Something I just wanted to unpack a little bit was around the unaccompanied asylum-seeking children, because it says we've currently got 15 and it's expected to rise and it's low compared with national formula. It'd be just interesting to know what would be the amount that would be for Plymouth to take if we were following the national formula, and what's the sort of figures likely to increase to over the next coming period, whatever the period that you're using.
Yes, so in terms of Plymouth, each local authority is given a quota of children and young people that we should be preparing ourselves to potentially take. One of the things that we know is that whilst our numbers are low right now, we have been doing a lot of targeted recruitment with our foster carers cohort to make sure that should our numbers rise, we have enough foster carers to be able to support those children with complex needs. Definitely numbers-wise, we would see double that number should we be within our agreed quota.
Paul, could I ask you to come in?
Yeah, I'll need to double check, but I think our quota sits at about 53. It's 0.01% of our child population.
Could I just, so that is correct, it is 0.1% of our child population, so that is just over 50 children. So there is a big distance between the number of children that we currently have, which on our most recent data is 18. The data that you've got is slightly lagged, so it's 18 today, under 18s. We do have 34 children that are over 18 and supported by our care leaver service as well. So, with the increase in the number of children and young people coming into the country, we do expect that to rise. And there is a challenge there for us in that, in terms of our ability to find the homes that we would want to for them as close to Plymouth as possible. So we are planning for that, as Temi says, with regards to our team. And we have invested in 2 social workers and 2 family support workers that solely work with our unaccompanied asylum-seeking children.
Thank you, David. Councillor McLean.
Thank you, Chair. I wanted to pick up on the out-of-hours service and the recruitment to stabilise that team, and the note that we have not had any suitable candidates as of yet. I wondered how much we've spent to date on that recruitment process, what we're doing to improve it, and also noting the amount of agency staff that we are currently taking in to fill that gap, and what we can do to potentially pull them over into local authority.
Absolutely. So in many local authorities, just for the context, recruiting into the out-of-hours service tends to be the sticking point because it's a niche way of working. It's often needing to be available overnight. So there's a particular group of practitioners that are more skilled to that nature of work. We haven't been successful in our recruitment for a permanent team manager in that space, and we have relied heavily on locum practitioners. However, what we have been doing is through the fortnightly recruitment panels, which I chair, we've just been looking at our wider recruitment strategy as a whole for recruiting in experienced social work practitioners, team managers, heads of service. And some of the strategies that we have been looking at has been how do we engage our adverts on different platforms, not just our council platform alone, but also the Guardian Jobs and other sites to ensure more reach and visibility. What we've also been looking at is how we can be within recruitment fairs and also hosting online recruitment events, and also how we ensure that we really celebrate our culture within Plymouth, which is a great place to work, and our social workers feed that back to us. So how do we make sure that that is also being echoed out so that it creates visibility to the role? Some of the other things that we have, we know that there will be government changes for agency social workers, and what we are looking at doing is our current cohort of agency social workers, those early conversations to acclimatise and bring them into the permanent fold, because we know they enjoy working within Plymouth. So actually, what would take for them to convert? What would that be? Those conversations are happening regularly with those group of practitioners.
Thank you very much, Timmy. Councillor Stevens.
Thank you very much. On page 67, it says that there was a sector-led improvement report or visit during August, and it was reported in September to the board. Are you at liberty to share some of the findings of that at this meeting?
So I was just going to say that Dorset, who are putting together that report, it will come to us, and I'm working with Democratic Support. We don't have Jake today, obviously, who's usually here, but the hope is that we can have a little extra meeting, a little extra scrutiny to look through that. Is that okay?
Thank you.
Perfect. Does anybody else want to say anything on that, Timmy? Okay. I have Councillor Tibbets.
Thank you, Chair. Just a question that came to me on the back of Councillor Maclay's question. I was wondering, in terms of vacancies that exist within the service, particularly the more, I don't like the word senior, but more senior roles in the team, are we looking at any strategies internally to help encourage our current fantastic social workers, team leaders, etc., to consider taking a step up, and so then we have the sense of stability within that service and someone that's already well equipped to understand Plymouth?
Thank you, Dylan. Timmy?
Yes, absolutely. We have a really detailed training package within our children's and education package for practitioners. Our academy is really robust, and I think I can share positively that we actually have seen through some of the actions that we've done, we've seen more traction on some more roles that we found harder to recruit. So we had 4 applicants recently for our head of service post, and that's a really stronger position that we've been in from maybe previous recruitment drives. But absolutely, the goal is always, how do we grow our own? How do we make sure that our newly qualified practitioners see themselves and see what they can do to grow within the organisation? And also for our team managers and service managers, there's been a real emphasis on their leadership, and there's been a revamped leadership training that's kind of underway, which all of the managers are engaged in currently. So absolutely, that's always the first thought before we go out to the wider market.
Thank you very much, Timmy. Are there any further questions? Councillor Maclay.
Thank you, Chair. I wanted to pick up on point 28 that said that 72% of plans require improvement. And I'm wondering if you could just expand on that a little bit more. What does that look like? How quickly will those improvements be implemented? And what kind of scale are we working at to make that number a little bit better?
Absolutely. So we are on a journey to outstanding, and I think that one of the things that we are doing regularly is through our audits and quality assurance, we're given ourselves a critical lens around our practice. Is it good? What can we do to improve it? Now, for the pieces of work, and once those audits happen where it does require improvement, there's a really detailed plan that sits alongside that, which the team managers, the social workers, myself, David, everyone is bought into and reviews to make sure that there's progress made around those recommendations. As a whole, we have a 3-year improvement plan, and I think we are at a place of, like, some of our system maturity means that we do know that it will take time to get to a place where we can turn that number around, where actually the majority of our work will show as good and outstanding. Some of the work that it's a whole system piece to do it, so part of that relates to the conversation we've had around social work recruitment. It also relates to how we make sure that we keep that audit culture alive in the organisation. So that's some of the examples that we're doing.
Thank you, Demi. Councillor Lang.
Yeah, I wanted to add that it's almost, to me, I'm actually pleased. I'm not pleased with the figures. That's not what I mean. But what I mean is that it's a strength of our reinvigorated QA and audit process that. And it has more of an honesty about where our work is and where it needs to be. And as Temi says, we're on a journey and we're getting there. But actually, this to me is evidence of our QA and audit process working better than it did in the past, and certainly before the ILACs that we had. Thanks.
Thank you very much, Councillor Lang. Any further questions? So I was going to just keep powering through, but my vice chair tells me we need a 5-minute break. So is everybody happy with 5 minutes? I'll see you back here in 5 minutes. Thank you. I'd like to welcome everybody back into the room. Thank you. Councillor Stevens, are you good? Thank you very much. I'd like to propose an amendment to the agenda given our time currently, and so I would like to move to item 10, performance report, if that is okay with everybody else, and we'll go back to, we'll do 11 and then we'll go back to 9 after that. Is that okay? Thank you very much. So item number 10, Q1 2024-25 performance report. Please can I hand over to Paul Stevens and Susan London to present the report.
Thank you. So yes, this is Q1, running from April through to June. Unfortunately, we're too close to the end of Q2 to provide that this meeting. So this is looking at those 3 months, the first 3 months of this financial year. As you know, the report will have the key indicators that we think are important for this scrutiny panel. I've got probably 400 plus indicators just for children's social care, and we won't want to bring all of that to you. So these are the key things that we think of the key things we need to keep an eye on, the sort of things that will go into the corporate plan, things that Ofsted might want to look at. It's those key bits that we've got in the report. Where we can, we bring in benchmarking information. The benchmarking information will be based on what is most recently published. So a lot of the children's social care information where we have benchmarking is actually the March 23 position, because the March 24 position won't be released until about December time. And it will be similar for the education information. We'll give you published information, but because it's 6 to 12, sometimes even 18 months until it's released, there is that lag on the benchmarking. Also, the indicators hopefully will tell you what period it's looking at. So I try and keep a lot of mine as a rolling 12-month view. So even though we're looking at the end of June, it will be the 12 months to the end of June. So hopefully the indicators will make that clear in the name. I think that's the gist of it, and I know most people in the room have seen the report a couple of times now, so just open it up to questions if you're happy with that.
Thank you very much, and it's good to see some positives in there. Councillor Wood.
Thank you. Yeah, I refer to page 110, and just make a note that it would be useful across all of the reports we receive if we could have consistent data and benchmarking. So far today, we've had some reports that go back to 2019-20, others that go to 21-22. Some have used England as the comparative, a Southwest and statistical neighbours. It would be very useful if we could have one consistent presentation of all of the reports to the committee so we can compare across each area. That would be useful, and I would highlight that to all those who present to us if we could make a note of that, please. Thank you.
Paul.
I follow what you're saying. The difficulty is some of the information, like I said just now, if, for example, though we've not got it in here, youth offending service, there's generally an 18-month lag. So we either give you what was most recently available for that information and benchmark it across everyone doing 2 years ago, and not give you the most recent benchmarking for another area. It's very difficult to give you the same benchmarking when it's published at different times for different areas.
Councillor Wood.
Thank you. Yeah, it would be, I note that, yeah, fair enough. It would be helpful if a majority could follow the same structure, and I think it'd be useful if the data we received went beyond just 21-22. Obviously a massive structural change to society with COVID. It would be useful to see the data for 10 years, could look at those longer terming trends, that would be okay.
Paul.
Yeah, I'm just wondering if we can maybe signpost something called the LGA Inform, which gives hundreds of indicators for hundreds of areas and does give a lot of historical information. I think that might be something that we can try and maybe set up and show the committee how to access and what's available in there. It's a huge resource.
Thank you very much, Paul. Elliot, could you log that as an action, please?
Yeah.
Councillor Stevens.
I think you've answered that. I don't see the point of going back too many years myself, because we want to know what's happening now, last year, the year before, rather than just have historical data there, which just will fill columns. That's my personal opinion, anyway.
Thank you very much. Any further questions? No? Thank you. We're moving on then to item 11, Plymouth Safeguarding Children Partnership Annual Report 2023 to 2024. Please can I hand over to Councillor Lang to introduce the item before moving to Siobhan Logue, Safeguarding Business Manager. Thank you.
Thank you, Chair. The Plymouth Safeguarding Children Partnership consists of statutory partners, police, health, children's services and education, alongside multiple other non-statutory partners. In December 2023, working together to safeguard children, the national guidance informing partner agencies how they need to work together to keep children safe was refreshed and published. The new guidance has given direction for how the annual report for the partnership will be published each year in September and will be representative of the previous financial year. As you will have seen, the report highlights some of the differences made for children, how the partnership implements learning, the funding arrangements for the partnership, independent scrutiny, and an update from the young safeguarders, and it also identifies future partnership work. This report will be further supported by the publication of the multi-agency safeguarding arrangements in December, which will describe the responsibilities of each agency in respect of safeguarding children. I think this is really important, but I think also it's important to say, it's a phrase that's used a lot, but I think it's true. Safeguarding is everybody's business, everyone in this room, everyone in the city. As you've read in the report, this has been a year of significant work in the partnership space, and all partners are embracing working together to make a difference for children and young people. The report does identify the need for more partnership data and analysis, and has also identified further work required in embedding new tools for practitioners in some agencies. The report also highlights the strengths that have been made through continuous learning and the creation of strategies, practice guidance and toolkits in priority areas, providing a much needed resource for practitioners in all organisations. This report describes the extensive multi-agency training programme offered by the partnership, and feedback from attendees within the report show us how paramount this training offer is to great partnership working. And I would add that as a member of this partnership, it's not something that just happens at the meetings that are in our calendars. We are constantly being sent updates, training, information. It's very much a live process that goes on all year round. Thank you, and over to you.
Would you like?
Good afternoon, everybody. I'll just open up for any questions.
Thank you very much. I would just like to say that I don't know how I miss this, because I am so proud of it, but I do work for Young Devon, which is one of the wonderful partnerships that work within this safeguarding. And it's really good to see how many people are involved in this. It really is positive, but I'd like to open up for questions. So do we have Councillor Stevens?
It's a great report, and I really like the cameos of people's lived experience as well. That's really powerful. Can I ask, I know the list is inexhaustive, as you mentioned, but is there collective representation from faith groups in the city? Because faith groups have contact with children and young people hugely, day in, day out. Are they represented?
Councillor Lang? Yeah, I'd like to second that question, because I too have raised that, because it feels like a big gap.
Okay.
Yeah, that is something we're working towards at the moment. We've been in touch with the Church of England safeguarding team, but obviously we appreciate there are many other faiths in the city, and we are trying to be in contact with multiple different safeguarding leads within that at the moment. We identified it as a gap, and it is something that we need to do some more work on this year, especially highlighted under the new Working Together guidance as we try and increase our reach within the partnership.
David.
Could I suggest to the panel that you have a recommendation to ask the chair of the Plymouth Children's Safeguarding Board to write to the key faith groups within the city, or those faith groups that we know are active, and to invite them to be part of. And then as chair of the Plymouth Children's Safeguarding Board, I will put in place a structure around that in terms of inviting them to meet reasonably informally, etc., and to encourage them to be part of our formal board and our structure.
I think that's quite important too, because I think sometimes, especially a difference in culture is confusing for particularly young people. I would need a proposer for said recommendation. Councillor Steele, and a seconder, Councillor Beer. Thank you. Any further questions? Thank you very much. Thank you, Susan. Sorry, getting confused. Item 9, family homes for Plymouth children. Members are advised that within their packs is a confidential slide pack. If there are any questions related to some of those slides, we will need to pass a resolution. Do we need to do that?
Resolution's taken.
Okay. Okay, if there are any questions related to some of those slides, we will need to pass a resolution to go into a private meeting on the basis of commercially sensitive information being contained. Please can I now hand over to Councillor Lang to introduce the report.
Thank you, Chair. This report outlines the progress and the strategic initiatives undertaken by Children's Social Care to transform practice for children at risk of entering care. The report emphasises the importance of improving placement sufficiency and outcomes for children and young people, ensuring that they're looked after in family homes in and close to Plymouth. This programme addresses the local authority's sufficiency aim to provide the right number and types of placements to meet the needs of children in care. The report highlights the challenges faced, including increased demand for services due to generational neglect, mental health issues and substance misuse, and outlines the steps taken to enhance foster care recruitment, support for complex needs, and market development for residential care. Key objectives include keeping children with their family networks where possible, increasing the number of in-house foster carers, and reducing reliance on high-cost residential placements. The programme also focuses on ensuring value for money and improving outcomes for children by providing stable family-based care settings. And there's a lot in this report that I'm really pleased about, but I'm also, the one thing I would draw your attention to is the progress that we've made in our plan to implement the Mockingbird model, which I think is a really positive model, and we've come quite a few steps along the work we need to do to get that model here in Plymouth.
Thank you very much, Councillor Lang. Do I have any questions for Councillor Stevens?
Can I ask the Plymouth provider of residential care mentioned in there, is that about having in-house provision here? Instantly to me, that looks a case of being, you're keeping children in Plymouth, in the city, in touch with other people. There's a saving of budget of travelling to places. Not budget of the provision, but there would be less travel. Is that something that it could be a scoping plan to see about the cost of that? Because it seems to be an investment, not financially, but investment in lives.
Councillor Lang?
Yeah, well, yeah, I mean, Temi can go into more detail, but yeah, this is something that, I mean, ever since I've had this role before, I had it now, you know, ever since I've been in this post since 2019 on and off, it's been something that I have been trying to push and pursue, and it's happening now, as in the pursuing of the plan, working up a business case and looking at how it would work. There's all the reasons that you just gave, but actually one of the big reasons for me to do it is around control of how we can operate those that provision, as in we have more control over whether a child stays there or moves. We can we have more input to that process. When it's a private provider, we can be very much at the mercy of whatever they want to do, basically. That's how the market operates, and I've spoken about that at length. It's no great surprise that I'm saying what I'm saying, but I think if you look across the country, council after council is doing this. There's many, many reasons for it, which Temi can go into, but yes, absolutely. For all the reasons that you've outlined and many more besides, it's imperative that we get on with the work of starting to create some of our own provision.
Thank you very much, Councillor Lang. Temi, would you like to speak? Or?
I don't think there's much to add, actually. One of the things, the reasons that you've said, for us more than anything is it just creates that permanency and identity for our children in Plymouth. There's real power in if there's a circumstance that's led to you not being able to live at home with your parents. What we don't want is for our children to lose their identity and then be placed in locations that are often really far and quite remote, and actually having that support and that wraparound support in a really therapeutic residential home set up within Plymouth means that our children are able to still go to their schools, still have links with their family and friends, and actually it's one of the things that we're really looking into and quite excited about.
Thank you very much, Temi. I would like to just draw people's attention to page 83 and 6D, which is reunifying children with their birth families and wide networks. If any of, I'm looking around, I can't remember now, but corporate parenting. At the end of corporate parenting, we always get a good news story. And I'm aware that obviously that's not broadcast, but it would be really good, David or Temi, if it was possible to bring a good news story so that people can understand how important it is and the positives. So we sit here and we pick apart things and work out how we can make things better, but actually sometimes there are some really good stories that are really positive. So I just wonder if that's something we could do you think?
Yeah, absolutely. We can definitely bring that in. We have many really good news stories over the last, I would say the last 3 to 5 months. We've had some really positive reunifications back home with fathers, and that for us really highlights around that whole family working, actually making sure that fathers are never forgotten in the picture, and it shows the journey we've been on as a children's services to make sure that we think about whole families, not just focusing on the maybe central parent, but thinking about who else is within the network, fathers, grandparents, so we can definitely bring an anonymised.
Yeah, I was really excited about that father's story in the last one, so that would be really good. I've just reminded David that we're going to have a conversation about that. Councillor Lang.
And it is actually, expanding on what Temi said, it's actually Kinship Care Week. And we've relaunched our special guardianship team, and we're really urging people who might be in a kinship care arrangement but not know that that's what it is, because that's not necessarily how anybody would describe it, where you're looking after a young person in your family or your wider family network or close friend. We're really urging people who might be in those arrangements that the council don't know about to get in contact with us, because there is a great deal of support for families that are operating in that way, and as I say, probably would never describe themselves that way. That's a children's social care description, but we want anybody who's in that position to contact us. There's a Facebook post on Plymouth City Council Facebook page about that, so if you can share that in your networks, that would be really helpful. Thank you.
Councillor Creswell, is it on the...
Yeah, I was just going to say good news stories is something that we could in fact do too, and from education, and I think it would be really valuable as well to have that as a standing section in this committee. I think it's really positive. Those narratives are always very very useful and help to actually frame and understand some of the work.
I'll hand over to David for that.
Suggests, and rather having a standalone report, we weave them into all of the reports. So in every report we have 2 or 3 cameos of case studies, and you will see in your confidential presentation that there are some case studies there as well, and one of those is the successful reunification that Temi has just described there, where we were able to reunite a son and a father, and it's quite a powerful and touching case study. And you know, we're absolutely committed to doing more and more of that through the work of Temi and Martine's team in our service. So if that's okay, while I've got the microphone for a second, we're also absolutely committed that we are going to run a cycle with children and young people coming into Scrutiny, and we've a proposal about how that works. So as from the next meeting, children and young people's engagement will take place through the Youth Parliament, and the children and young people will have prepped on a couple of reports and will come in then to that and every subsequent meeting.
And isn't that good news? Can we put that down as a recommendation, please, that we weave in some good news stories? Thank you. Councillor Wood.
Thank you, Chair. I refer to paragraph 3 and indeed 4 on page 80. We highlight that the number of children in care on the table has increased through the last financial year. I therefore refer back to the previous agenda item 7, where we noted that the number of unaccompanied asylum seeker children was currently 15, but the quota level we could receive would be 53. Would therefore my assumption be correct that were our quota of 53 to be required to be met, there is a risk that that graph could go up by possibly 10%? And if that was the case, are we sufficiently resourced and prepared for it?
Temi?
Yes, so the forecast that you've described is what would happen. Part of the work that we have been doing to ensure that we are prepared for it has been one of the strands that sits under our work stream here is how do we recruit more foster carers, and there's a real drive around being in all parts of the city, you know, from being in ASDA to the gyms to the local community centres, to really drive up our recruitment activity, because we know that that is our streamline for our children, for them to be able to be within Plymouth in family homes. So that work is underway. The fostering service is also completing a plan around growth for their team and what that would look like should we see the increase that we forecasted. So a 3-year plan around what growth in their team would look like to allow them to respond to the potential increase.
Councillor Wood.
Thank you very much indeed for that answer. One quick follow-up. Does the funding for those unaccompanied asylum seeker children come out of our existing budget, or does money from central government follow those children and provide the funding to cover them?
Some money follows that cohort of children, and some of the money that follows them relates to how quickly we can identify homes for them. And one of the things that we've been able to do well is actually within the window of 10 working days, there's some funding allocated to the local authority if we're able to place our children. And on average, what we've been able to do is to place our current cohort of children within either 5 working days, in some instances 2 working days. So funding does follow them in that aspect. But in terms of the wider, you know, their wider status as looked after children, that funding would come from our local authority budget.
Thank you very much, Temi. Lisa?
The virtual school also receives funding for those young people as part of the Pupil Premium Plus funding for their education.
Thank you for that, Lisa. Councillor Krisnak.
Not too long ago, we as a council have put a motion through the council chamber regarding extortionism of the big companies fleecing our councils and the most vulnerable in our society. And looking at these figures of £5,800 per week, paying for a placement of a child is something that we need to be very, very aware. Also, I just wonder what kind of interactions with the other authorities we had where the good practices in other authorities have taken place where their costs per child and the placement of a child are dramatically reduced. Thank you.
Councillor Lang?
I mean, I think people have heard me say this before, but it's worth saying again, and it goes to Councillor Stevens' point about why we need to start creating our own provision. We need to try and kind of, it's a horrible phrase, but kind of disrupt the market a bit. We're in a very poor position, and this is the same with other local authorities, not a Plymouth thing, when it comes to negotiating how much we have to pay for those placements. We don't really have a bargaining position, and if we say, well, you know, and we've employed people to do this, to go around the providers and say, you know, what can we do here around the cost? And they're like, well, if you don't want to pay it, there'll be another local authority that needs that place, and they'll pay it. And so it's a very unequal position that we're in as an authority. And again, I have to reiterate, not just Plymouth, but I think, I mean, I'm going to the LGA conference in Harrogate in a couple of weeks, and it's my absolute goal to get to speak to the Children's Minister to say, you know, to lobby and feedback, and I'm sure that she will have heard it from local authorities all over the country, but I want to put the Plymouth position and say something's got to be done about this. You know, in Wales they are working to remove profit from children's social care, and whether that's a model we eventually adopt or whether we cap or what, we have some kind of mechanism that means that we just can't be charged, you know, an arm and a leg for every placement. It feels like a very, you know, we're bringing a report to Cabinet every month about the financial position of children's social care in Plymouth. We're being absolutely transparent about the issue and the challenge that we face, and I think that's really important, and I'm really glad we're doing that, because I think unless you have had some kind of involvement in children's social care as a council taxpayer in Plymouth, you probably don't know where so much of your council tax is going on these absolutely vital services. I'm not saying we shouldn't be providing it. We should, and we have to make sure we're providing the best care we can. But I think most people probably have no clue, and that's why I'm trying to kind of up the visibility of where we're spending that money, why we're spending that money, and what we're trying to do to tackle it. We can do a lot locally, and we have, you know, weekly meeting where we're looking at this and you know, thinking absolutely outside the box and trying to be really innovative and trying things. But until there's some kind of shift at national level, I don't think we can. It won't be fixed with some kind of national intervention as well.
Thank you very much, Councillor Beer.
First of all, huge thank you, because the team has done incredible work in this department. I couldn't be more proud of the involvement that you've had in this. And I also want to pay tribute to our excellent foster carers in Plymouth who tirelessly work for our young people. And a lot of them I do know personally, and I want to thank them, and I want that on record. Thank you. Can I just ask, please, having read this, it does concern me that a lot of children are coming into care. What are the reasons for that happening? Has it changed since, I'll harp on this, 2017 when I was the Cabinet member? Has the circumstances changed on this?
So there are many factors around why some of our children, young people are becoming looked after. One of the things that we still kind of see is the long-term impact of COVID, and that creating compound needs for some families, compounded mental health challenges. We're seeing the impact of maybe generational neglect for families. So actually, we're seeing that there are some families that have had children's social care involved with them previously. There have been some patterns that haven't been able to move. What we're also seeing is the impact of just the cost of living crisis in some families, which is also poverty does play a role in how some of our families can feel confident in offering what would be good enough care for some of our children in Plymouth. So many factors. I think if I had to, that it would be unjust to nail it to saying, actually, this is the only precipitating cause. And I'm also sure that maybe from the time that you were, some of those factors will mirror, to be fair.
Chair, I just thought it was important to raise that comment because some of our newer members on the committee will not be aware of the changes that have gone on. So it's nice for them to get an explanation. And I thank Temi for doing that. Thank you.
Thank you, Councillor Beer. Councillor Lang, sorry. I was going to add that I think we're seeing more neglect. That is a thing that we're seeing. And we were seeing more... and Martine's here, so she can help me with this as well, but we were seeing more teenagers, family breakdown around kind of 16, 17, weren't we? And actually, I think it's also important to talk about some of the prevention, and I know we're going to go on to early help and stuff in a minute, but some of the prevention work that's actually stopped, especially over the last few months, stopped some of those teenage young people coming into care, really thoughtful, intensive preventative work, family support, to stop that happening. So it's a kind of a balance thing, as in, I guess what I'm saying is it could be, the numbers could be higher if we weren't doing this innovative work around that particular age group, which were causing a spike in our numbers a while back. Thank you, Councillor Lang. Did you want to say something?
Thank you, Chair, and I'll be very brief. So I just want to say that as your children's services get better, you sometimes see a spike in children coming into care. We certainly saw that in Rotherham. And secondly, it's a bit of a pledge for if there's anything that we can do in Rotherham to help. So we've got 11 children's homes open now in Rotherham, soon to be opening our 12th. It's a bumpy ride, it's a difficult journey, but if there's anything that we can do and have any conversations with us in Rotherham after today, then I'd be happy to do that. Thanks.
I'm happy to propose a recommendation that we look into that. Can I get some hands if you agree? Thank you very much. Elliot? Thank you. I have Councillor McClay.
Thank you, Chair. This report made me quite angry reading about how young people are kind of being exploited for profit in the system. I was livid. And I'm really pleased to hear about the steps that Councillor Lang explained that we're taking to maybe bring some of that provision in-house. On the point of national intervention that you also raised, Councillor Lang, I wanted to kind of dig into that. The national target for care proceedings is 26 weeks. We have 78 who are currently waiting over 50 weeks. Is this a pattern that's being repeated across the country? I know there's a glut in the legal system anyway, and what we can be doing to try and influence to bring that time down.
I know those conversations are happening with the judiciary. I think it's still, I don't know if it's fair to say it's still a post-COVID thing, but I think it is. I mean, I think it's still working its way through the system, but I know, I mean, you'll know, David will know more than me, but I know those conversations are being had because of the knock-on and the impact that it's having.
So this is a national situation, and the courts working their timescales from pre and post-COVID, actually, really, but it does get labelled as an issue that was certainly exaggerated during COVID. We have a really strong relationship with the judiciary, directly with Her Honour the Judge, and my colleagues are working with her directly and reprioritising children and prioritising Plymouth children to move through the court proceedings. So the one element is around court time and timeliness. There are other elements which are related to practice, where, for example, during the end of the process, a family might come forward and offer some some different family members that they then ask us, and the court then asks us to do an assessment on those family members, and that then extends the court time. So we do have a court progression officer who is a senior social worker who is monitoring all of the cases, and that's her role to do that, and that is having an impact, because if there is any delay or expected delay within our processes within children's social care, she can challenge that directly with the senior social work managers. So it is something we're very aware of, and we have monthly reports to my quality assurance board that's monitoring the progress of that, because it's right for children. You know, if children, the sooner the right decision can be made on behalf of children, that of course is the right thing for them.
Thank you very much, David. Are there any further questions? Okay. I would like to propose a recommendation that the fostering service provides information on recruitment of foster carers and encourages them to be champions of the fostering in Plymouth. Can I get a show of hands for? Well, yeah. Councillor Wood seconding. Thank you. Also, before we move on to item 12, we are likely to run over today, but I understand that people may need to leave at 5 p.m. and that's okay as well, so thank you. Moving on to item 12, early help. Can I hand over to Councillor Lang, please, to introduce the report?
Thank you, Chair. So in 2021, the multi-agency vision for Plymouth, A Bright Future 2021 to 2026, was published. And that outlined how local partners plan to support the best outcomes for all children. Our early vision is that early help is to ensure that every child and their family can access and receive timely, effective support from trusted sources. We aim to build supportive, trusted relationships around families and communities, addressing diversity and equity to provide equal life chances for all children in our city. Today, the delivery of early help and prevention is a fundamental project in the One Children's Service programme, and it aims to, in collaboration with all key city partners, build on the existing early help offer and delivery of family hubs to develop a network of services, processes and interactions that are able to understand, predict the need and respond together to help children, young people and families at the very earliest opportunity. Thank you.
Thank you, Councillor Lang. Martine?
So this is quite an apt moment to start talking about early help in a space where we're talking about the increase in children coming into care. And the absolute focus now for us is about how do we get out into our communities, how do we encourage our kinship carers, how do we encourage our families to support each other. So this report is a highlight of all of the work that's being done across the city at the moment. In respect of us, how we drive forward our community-based services, how we encourage our communities to become the solution and part of the solution with us. But happy to take any questions.
Thank you, Martine. So I work in this area, and the importance of early help is even more apparent to me now than it was before my current job. And there are lots of things that I wanted to discuss that I'm probably happy to have a meeting at some point. But I guess the most important thing is the family hubs, and what is the impact of those family hubs, and can we challenge them to be more impactful? And what I mean by that is we have certain community builders. We have a family hub community builder I've met, and it's wonderful. The ideas are fantastic. But we have other community builders that we could potentially bring in on this. And there's so much like domestic abuse and all the things that are very rarely spoken about when I visit these places. So I just wonder, a lot of the young people that I deal with, there is a golden thread, and that golden thread tends to be a domestic abuse somewhere. And so I just wonder what we're doing to, what is the impact and how are we making the best of what we've got there? Thank you.
So the family hubs, we've got 9 family hubs in the city today. We will have 10, I think, by the end of this year, with the potential of more. We can be doing more in that space, absolutely. I have just recently taken on the lead for our family hubs for the last 6 months, and we're doing a lot of work at the moment to make sure that we are targeting the right children, the most vulnerable children in our city. That work will be ongoing, and there will always be something else to do. In respect of domestic abuse, it still is a space where people worry about opening that up, and that's got to be about more training, more supporting our family hub staff, our early help staff, our practitioners that are on that front line to feel confident in how they address that, because people will often be really worried around addressing it, and I think we all know that. What I'm proposing over the next 6 months is that we really start to think about how do we tie in an induction package around our workforce development, so our absolute frontline workers are getting the training that they need in respect of it, but there will always be more work to do. I worked myself 15 years ago in the domestic violence world, and it doesn't feel like it's moved on much since then. There's always more work for us to do there.
You're absolutely right, and every day there is something new that I think, oh my gosh, how did this happen? So yeah, no, I really appreciate that, and I'd be really welcome to be part of any of those conversations moving forward. Do I have any questions? Councillor Stevens.
Thank you. It's good news, this, and linked in with what we've discussed already. Are there opportunities for undergraduates at the university in social care to link in with family hubs, not only to enhance their experience, but we gain from it, and maybe it's an avenue for them to be recruited to the service when they've qualified?
Absolutely, and please feel free to link me with anyone who I would take them. I actually love undergraduate social workers coming to work in the early help and the preventative services, because it gives them a really good grounding in that real frontline work. Often social workers are taken away from that sort of really frontline space, so it starts their development and their journey into social work in a very different way. And I would be more than happy to support that. My own service takes first and second year students. For that reason, exactly, because we're not in that statutory space, it means it's easier for us to be able to manage that, but give those people the experience they need.
Councillor Lang?
Yeah, I just want to say that I'm really proud of what we've done already in this space. And yes, of course, there's much to do. We know we've helped more than 800 families so far since the launch of all these hubs, and it's the continual kind of argument around these non-statutory services. Actually, their impact is so huge, but when you're worrying about what we've talked about, what you're paying for residential placements, where are you going to put your money? But I think it's like a no-brainer, isn't it? You know, if you can help at this point, rather than having to intervene at this point, then the outcomes are better, most importantly for the children and families, for the budget, for all those other things. So I think, yes, you know, it's a developing model still, but I'm pleased that we've got to 9 already, and I'm excited to see where we go and we start really measuring the impact in our communities of having these hubs and having that work happening in places where people are.
Yeah, I would just like to say, actually, listening to other authorities, we are quite far along on the family hub thing. It's quite something to be proud of, for sure. But we always look for progress, right? Councillor Wood.
Thank you, Chair. I note that the family hubs, the 9 of them, form quite a large circle, but there's quite a gap in the middle where there isn't the provision within the centre of that circle, particularly for Buckland or for Compton, and they're obviously incredibly useful if they're within walking distance or in a community. Do we have the plans with the 10th to have it located more in the centre of that circle, or any other plans at all?
So the 10th Family Hub is a family hub that's going to be situated in a site that's already a children's centre. But the next phase, the next 6 months of the work that we're doing, is thinking about our communities and what we can put into those communities. So like satellite hubs, effectively, where we have integrated community-based teams. So the idea for me now, and the work that we're doing at the moment, is we're asset mapping across the city. So where is the need? Where are the resources that we've already got? And how do we build and develop on those resources? And then link those in with the current family hubs that we have. So we know that there are gaps across the city, but also we know that we need to be really targeted in thinking about what support we need in each area, and what do our children and families want in their areas, because often we can plough in and do what we think is the right thing, but actually sometimes we need to stop and think about them. One of the pieces of work that we're doing is I'm working with both All Saints and with Mill-based schools to think about could they become a bit of a hub as such, and some of the primary schools as well, so that we can really start to introduce children and families as schools being a place where they can go and get the help and support they need, start to increase their engagement with schools. So buildings are a bit of an issue for us. We don't have lots of buildings, so we're thinking outside the box about where we can put these teams to really make sure that our children and families can access services quickly and effectively.
Thank you, Martine. Are there any further questions? No. The early help strategy is on the website. It's published on the website for anybody who wants to take a look at that. I would like to make a recommendation that a whole council information briefing on early help and about the available, what is available within our communities, so we can relay that to our residents, and we know where local residents can access these services. Can I get a seconder? Councillor Stevens, and a show of hands. Thank you very much. Any further questions? Moving on then to item 13, Youth Justice. Please can I hand over to Councillor Lang to introduce the report before going to Martine, Head of Service. Thank you.
Thank you, Chair. Plymouth Youth Justice, it's easy for me to say, Plymouth Youth Justice Service is a multidisciplinary team that is funded through contributions from the Youth Justice Board, Plymouth City Council, the police, health service and probation. Plymouth Youth Justice Service is aligned to the core principles set out in A Bright Future for children in Plymouth to be safe, healthy and happy, and to achieve and aspire, and the priorities set out by the Youth Justice Board's Child First commitment. There have been significant achievements in the past year in relation to improving outcomes for our children in the city, including low numbers of children in custody, fewer children entering the youth justice system, a reduction in children reoffending, and those accessing education, employment and training remains high when compared to the national average. Working in partnership with the police, children's social care, education and community youth, our diversion scheme, the Impact Project, supports the prevention of children entering the criminal justice system. We believe this project is largely the reason we've seen the reduction of the first-time entrance rate. Through the project, we offer interventions at the earliest opportunity and build on the delivery of out-of-court disposals, which brings together the most appropriate agencies at the earliest point of decision-making. This helps to ensure swift multi-agency discussions, improve outcomes for children, and reduce the risk of offending and harm to the community whilst diverting them from the criminal justice system. The HMIP inspected Plymouth Youth Justice Service in 2022 and was impressed by the progress made, and the overall rating given was good. And a recent visit from the CEO of the Youth Justice Board highlighted strong partnership working was on show in Plymouth, and relationships at the service really stood out, be they with staff and children or external partners. And I was pleased to meet her as well, and you could see that she was impressed with what was going on in Plymouth. Really proud of the team, and hand over to Martine for the report. Thank you. Martine?
So I think our approach to youth justice mirrors my approach to preventative work. And so we're really lucky in Plymouth. We've got a strong partnership. We've got strong commitment from our partners in ensuring our children get the best outcomes. And we've sort of proven that we are exceptionally proud of the work we do. So I suppose it just models the absolute way that partners and multi-agencies can come together for some of the most risky young people and for those most vulnerable young people, and work in a way that doesn't label them or criminalise them. So I'm just open to any questions about the Youth Justice Service.
Thank you very much, Martine, and I have been assured this week about how strong those partnerships are, and I know that we have a briefing coming up in December on this sort of thing, so that's really, really good as well. Councillor Beer.
Thank you, Chair. I don't want to say child sexual exploitation is my baby, but actually it was something that I brought to this council to highlight the issue. Often child sexual exploitation or exploitation of boys and girls is done under the radar, and crimes are committed through that. Are we finding at any stage that any of our young people who are coming through the criminal justice system have been groomed in some way or exploited because of their age and their vulnerability?
About 41% of our young people are. There is some elements of exploitation, either criminal or sexual exploitation. However, on a positive, what I would say is that our response to that is amazing. Our police force have really worked hard over the last sort of 2 years really for us to recognise that, recognise these young people as victims and not as perpetrators, and put the support in as opposed to the historically what would have been a real sort of judgment in respect of how they breaching them and taking them back into the court system. Part of the reason why our offending rates are coming down is because we are treating these young people as the victims they should be treated as opposed to the perpetrators of abuse. So it is high. It's much harder to find, to understand, but we have a great range of people who are really persistent in digging out that world. And so we have put our exploitation team into our youth justice service to make sure that the combination is, the join up is much better. We have our daily intelligence briefing, which really helps us get the intel that we need from the police sort of every day. So any child that comes into custody, we are having those multidisciplinary conversations as soon as that morning to think about actually what do we need to do to understand these children. Our education services are part of those conversations, health, etc., so that we can really unpick that at a very early stage. But yeah, it's a real worry, but I think as a city we respond really well now to that, and probably knowing that it's 41% of all the children is a good thing for us, because it's not hidden for us. We are actively searching that out all the time.
I dare say there's probably some hidden ones out there that we don't know about, and that terrifies me, quite frankly. I'm glad that we're making progress in seeking out those who exploit children for gratification in one way or another. I'm glad that I brought that to this council, and I'm just so shocked. I had a lot of learning from colleagues in Rotherham at the time with regards to child sexual exploitation. And I'm sorry I'm getting emotional about this, because it is so awful that what they put young people through, and up until recently we would have punished those young people. And I'm so pleased to hear that actually that's reversed now, and you're actually helping them as victims. Thank you.
Thank you, Councillor Beer, and thank you for being honest, because that is shocking. That's shocking to hear. And I know that obviously a lot of work is being done, and I know that no one in this room or in this authority wouldn't do everything they could possibly do to stop it, but that is a really hard thing to hear. And I think as well, every report that we've heard today, exclusions and early help and everything, it all ties in together, I imagine. And so it's really important that we keep doing this and keep talking about this for sure. Councillor Lang, would you like to?
I wanted to add a quick thing about the DIB, the Daily Intelligence Briefing. I've been to that, and to underline what Martine said around it's so child-centred and child-focused, and I was just blown away by the knowledge of each individual child, and everybody was giving up, I don't know, is it half an hour at the beginning of every day, partners from across the city to come to this meeting to talk about individual children, and it was something that the CEO of the Youth Justice Board commented on as well. It's an example of best practice and absolute child-centred work.
Thank you, Councillor Lang. Councillor Macleay.
Thank you, Chair. I want to pick up on the point about knife crime. I noticed that in 2023 we saw a rise and then did some work to address it. Since that work has been carried out, have we noticed those numbers fall? And are we continuing to follow up with those young people who've been seen carrying knives on a kind of regular basis, just to check that they're moving away from that path, for lack of a better phrase?
So Plymouth, we don't have the same issue nationally. That's not unusual in Plymouth. Sometimes we join the party a little bit late down here, so it's something that we've been monitoring for quite some time, because we've been watching it nationally rise, and so we're constantly working with the police to really understand. I think in the report I talk about, we're more worried about some of our young females at the moment in respect of that, but so we monitor knife crime probably about every 6 months, just to make sure, alongside the police, make sure we're not seeing any further rises. We do work with those. It is voluntary, because if young people aren't given an order, they can only work with us voluntarily, but we've got a really strong prevention service, so impact is we have more children on our impact project than we have on our statutory order side at the moment, which is really positive for us. So yeah, we will follow up with them. They build really good relationships with them. The whole service is built around relationship building. So even when we finish our intervention, those young people can come back and speak to us. Our building is closed at the moment, but usually our building would be open and they can come back and talk to us in the evenings, etc., if they feel that they need additional support. So it is something that we will follow up always. And if they come back in again for another issue, we will very quickly try and to sort of reconnect them with the worker that they had so that we can get back in there. But it's a constant piece of work. But, and I still touch wood, Plymouth is not at the moment seeing the same increase that some of our local areas are.
Could I add, Chair, that the building's closed for a good reason?
It is.
Because it's being transformed, thanks to the Youth Investment Fund.
Thank you, Councillor Lang. Councillor Stevens.
Can I ask about the female violence? Is that, I know it says you're curious about what's the cause of it. Is that something that's cropped up in other parts of the country as well?
So my youth justice service manager is really interested. He's always looking for themes and trends in the way that we work. He does like that. So he's spoken to the regionally. They didn't think they were seeing a rise until he raised it in their regional meeting. They are now also seeing a rise. We've done lots of work with our police. The police are talking about a 35% rise. We're not seeing a 35% rise for female violence, but we are seeing it was about 20-22% in our cohort. So they're doing a lot of work at the moment to really understand what is behind that. So because we don't understand what's behind that, but what we are very concerned about, it does tend to be gang. We don't have gangs in Plymouth, but it does appear to be gangs of young females who are assaulting single and lone males and females and videoing that, which is a pattern of behaviour that we saw historically with boys. So they have been to the partnership, this community safety partnership. We have commissioned Plymouth Argyle to do some work. We have looked wider across nationally. There are no programmes for violent females. There are for men, but not specific for females who are violent. So we're in the process of developing one alongside our Plymouth Argyle to work with us. They will be going into schools, and they've picked some schools where we know that some of these offences, these incidents and issues are happening, and they will be starting to work with young female students across the city in a preventative way to try and address some of these concerns that we've got.
What's the youngest in that group? I mean, individually, but
that I know of,
range?
11.
11. Right.
Yeah.
Thank you.
Thank you, Councillor Stevens. Thank you, Marty. I wonder if maybe David might answer my question about youth service, the detached youth service team. I've spent quite a bit of time with them, and obviously, having worked at an alternative provision, they come into those schools quite regularly, and the relationship that the young people have is really good compared to that with other members of staff. I wonder if we could probably get a little bit more of an insight into what the work that they do for this, for the interest of the panel. Would that be something we could do?
Of course. However you want to do that, we can have a report to our next meeting or wherever it can fit on the forward plan, or we could provide an opportunity for scrutiny members to engage directly with the teams. So just however you would feel you'd like to do that.
Are you happy to leave that with me, and let's see how it can work better? Because going out with this team, like seeing them at the youth clubs, and is phenomenal.
That's the way to do it, Councillor Riley. That would be very powerful, wouldn't it? If members would like to have an initial briefing and introduction with the team, information briefing, and then have the opportunity to go out with them and to be part of some of the work that they do. So we can most definitely organise that.
Massive advocate for that, because then we build a bridge, don't we, between those important people and, yeah, whatever. Thank you very much. Councillor Lang?
Obviously, some of the youth clubs are closed at the moment because of the IF work, but I guess this will be quite long in the planning.
We have quite a work programme at the moment. Any further questions?
I don't know if I'm allowed to well, I'm not making recommendations, but I'm suggesting something about the violence with girls work. I just don't know what that recommendation would look like, but seeing as Martine says this is kind of groundbreaking programme that's being developed, it might be something you want to revisit.
Absolutely. We are currently, myself and Jake, the Democratic support team, are trying to put together a select committee, and I'm more than happy to work to get people in on that, to have a better understanding of some things that perhaps we don't have time to talk about here in this 3 hours. Would that be, should I make a recommendation to add that to a work programme for a select committee, Jake? Elliot, sorry.
Yeah, through you, Chair. It would be a good idea to note it as an action to bring up during the agenda set for that select committee.
Thank you very much. Okay, moving on to the work programme. Are there any items councillors would like to add to the work programme? Councillor Macleay.
Thank you, Chair. I did wonder if under the cost of education item we could maybe look into the cost of school uniforms. It was raised by one of the head teachers today, and I've read a few articles about the growing cost of branded items that schools are asking for. So I wonder if there's some benchmarking we can do there, and also potentially something around free school meals as well to check uptake. And also knowing that there's about 1 million kids who are in poverty who aren't eligible for free school meals, and if there's anything, again, that we can look into regarding that.
We can certainly add that to the work programme. Thank you, Councillor Macleay. Councillor Wood.
Thank you, Chair. I wonder if it's within the spectrum of this committee. We know that fitness and health for children is incredibly important. We've heard today about the sense of community amongst children in schools. I've heard from quite a number of parents about possibly the lack in some areas of play equipment and the availability of just fields to go and play. Now, is that something that we can consider within this committee, or is it outside the scope of this committee?
David?
It is likely to be out of the scope of this committee in terms of the provision and where the provision is across the city. That would be more into the growth scrutiny committee. The impact of that on children and young people would be what we would be interested in, but I would suggest that's routed initially through into the growth, the scrutiny committee for what was placed, which is now growth.
Through you, Chair, that would be an item for the health scrutiny committee.
Oh, okay.
Yeah, it would be a good idea to take that to the scrutiny management board to discuss where that best fits.
Thank you, that's why I was pointing at you.
We'll get there.
Thank you, Councillor Wood. That's noted. Any other comments? Anything else you would like to see on the work programme? David?
This isn't the work programme, but I would just like to remind you of the invitation to our practice week, which is the week of Monday, the 18th of November. So you're very welcome to come and observe practice in an area of the service that you would be particularly interested in. There has been a note out to members. I'll make sure that note comes out again, and just contact one of the team just to have a conversation about something you might be interested in seeing. There are during the course of the week, each lunchtime, there are some lunch and learn sessions which have each got a particular topic. That's 5 days during that week, and then lots of opportunity for people to visit and observe practice across all of children's services. So you're very welcome to attend that and just have a conversation if you'd like to follow that up.
Thank you, David. Are those lunch and learns recorded? So we could watch them if we're not available at that time. That's fantastic, thank you. Okay, so moving on to item 15, tracking decisions. Can I hand that over to you, Elliot, please?
Yeah, thank you, Chair. So in response to tracking decision 13, the report on agenda item 7 today covered this request. So if members are happy, that action can be marked complete. For tracking decision 14, the attendance strategy has been circulated to panel members prior to this meeting and can also therefore be marked as complete. Tracking decision 15, work to action. This is ongoing and a conclusive response will be provided at the next meeting of this panel in November. For tracking decision 16 is also ongoing, as set out with details in the action log. A further update will be brought back in November. Number 17, in response to tracking decision 17, it's been confirmed that the shortest wait for EHCP was 19 weeks and the longest was 45 weeks. CAM's waiting times will be reported to the meeting in November. Tracking decision 18, an update will be brought in November. And finally, 19, a briefing session for members on child exploitation and county lines has been scheduled for the 3rd of December 2024, and this action can therefore be marked as complete. Thank you, Chair.
Thank you very much. We didn't go into part 2, did we? No. And so is the panel happy to agree the confidential minutes of the meeting that took place on the 18th of July 2024? Could I see a show of hands, please? Thank you. So I'm happy to close the meeting. Thank you very much for your time today, and we're only 2 minutes over. Thank you very much.